Hi, folks. This is Amanda Polley with DBHR, and I just want to let you know that we'll be getting started in just a few minutes. We just want to make sure that everybody who's registered or is close to it has an ability to hop on here and doesn't miss any of this important information. So you'll probably hear some more silence, and you should be seeing in just a few minutes our opening slides, so hold tight. All right. Good morning, everyone. We're going to go ahead and get started. My name is Kimberly Castle, and I am the Supportive Housing Program Manager at DBHR. We're really excited to have everyone with us today to learn about foundational community supports. I'm here with my colleagues, Darren, Amanda, and Dawn, all of which are also trainers for foundational community supports, and you'll get to hear from each of us today. What we'd like from everyone is to use the chat box and just tell us who you are, what program you're with, and we're really excited to be talking with everyone today about supportive housing, supportive employment. So please, if you have any questions, we can go through those. There'll be times when we'll be asking for questions. So if you want to pop them in the question box, you can, and then we'll have time for Q&A throughout. We also plan to take some breaks today. So just know that we will give you a minute to get up and have a break during this time. All right, let's get started.
Good morning, everyone. My name is Dawn Miller, and I am the Supported Employment Program Manager for the east side of the state. So my responsibilities are to do training with staff and to be lead for fidelity reviews. And like all the rest of us, other duties is assigned. Could you advance this slide, please?
To slide 2 or 3?
3. So we're going to talk a little bit about social determinants of health. We've all heard about them. They truly are the basis for foundational community supports. and the reason that Medicaid will pay for supported employment and supportive housing. Medicaid pays for issues that are medically related. They pay for issues that affect our health. And though it may not always be apparent that the social determinants of health really do affect our health, they do. There are various studies out there that can be researched in order to determine the effect. With housing, it's fairly apparent. If you're not housed, you don't have a place to keep food refrigerated. You don't have a place to keep medication should you need them, or your belongings, or to take a shower, or to get a good night's sleep and not live in fear that someone's going to accost you or end up stealing your belongings. So all of those things affect a person's health. Maybe a little less apparent with work, but I will say that I've seen studies that indicate, and I think the most extreme of them indicates that people who are chronically unemployed may die up to 25 years earlier than those of us that are typically employed, which is absolutely huge. And how could it not be a medical issue given that that's the fact? When you think about it, however, work is so integral to so many things. We get a sense of purpose from work. We get a sense of belonging, so it impacts our mental health in a positive way. We end up earning a wage, which may allow us to pay for our housing and food and medical costs and those kinds of things. We have a sense of purpose that creates a schedule during our day, which is typically also good for things like those of us that are working with folks with mental health, and that's all of us, know that people, when they have mental health issues, will tend to ruminate on them. And when they have scheduled and positive activity, they have less time to ruminate. So that's one of the reasons why it's good for your mental health. So it's real apparent that the social determinants of health truly are health related, and they truly are the reason why Medicaid is willing to pay for foundational community support. Next slide, please, Darren. So I'm going to give you just a little bit of history, not much. So no worries. The legislature directed the state of Washington and Healthcare Authority in this case, staff, in order to begin working on foundational community supports. Let me back up. I apologize. I'm stumbling over my words today, and we all joke about the fact for need for coffee, and that's evidently my problem today. I'm going to start over again on this slide. So the legislature passed Senate Bill 5732 and House Bill 1519 in 2013, which was truly the precursor to foundational community support. When those bills were passed, the personnel at the state of Washington sought out policy academies and received two, one for supportive housing and one for supported employment. Policy Academy, in the case of supported employment, was the Olmsted Policy Academy, and the intent was to be proactive in improving our services to people with serious mental illness. The Academy functioned for a number of years, and in fact still does, to the degree that it's the Supported Employment Coordinating Committee for the state of Washington, so it's not yet disbanded. I was part of that Policy Academy early on, and what we ended up doing was to contact various different states, find out what they were doing that was innovative related to supported employment, find out what their funding sources were and how they interacted with DVR and a variety of things. And then through that training, ended up determining which Medicaid funding source might be relevant for the state of Washington, and put together a pretty significant strategic plan. The one for supported employment had three prongs, and it is still in use, very honestly. And it related to educating the community, educating individuals, working on that, decreasing the self-stigma that comes from having been told, perhaps all your life, gee, you have a disability, you have a serious mental illness, you can't work, when in fact the opposite is true. Anyone can work with a good job match. Anyone can work with the supports needed to do so, and anyone can be housed with supports and assistance in order to do so. And so the strategic plan had the prongs to educate. It also had prongs related to the different tasks that we've done. obtaining funding. The Medicaid Transformation Project, demonstration project that we're under at this point in time, was one that was researched and being used in other states very effectively, and was the one that the state of Washington chose in order to move forward. Fast forward a little bit, each of the two different programs, housing and employment, had pilot projects. I was part of the one for supported employment. It was the BEST grant. Becoming Employed starts today. Was a SAMHSA grant in order to use the evidence-based practice of individual placement and support. And frankly, to start collecting data related to that and determine if truly it was the way that we wanted to go, and it was. And so that brings us forward to this point in time. We now have a statewide network of agencies that have signed on with AmeriGroup, the third-party administrator, to do supportive housing and to do supported employment. The recent push, as you all know, because you're a part of this project or this grant, and the current intent of reaching out to agencies that provide substance use disorder services and helping them to start supported employment or supportive housing to be added to their book of business. Next slide, please, Darren. I believe we're over to Kimberly.
I think the AmeriGroup is mine. Welcome, everybody. The Healthcare Authority. Oh, I'm sorry?
Oh, I just said
Darren,
okay.
Darren, we're losing you.
Oh, even on the phone?
Oh, you're good now.
There we go.
Okay, I'll hold it up. Thank you for the technical assistance. It does take a team sometimes to get through some technology. And I started off today thinking I had no problems, but so much for that. So thank you for your patience. The Healthcare Authority holds the contract with AmeriGroup, which is the third-party administrator for the foundational community supports contracts. And it's really a collaboration effort between the Center of Medicaid Services, the Healthcare Authority, the Department of Social and Health Services, the Division of Behavioral Health and Recovery, Aging and Long-Term Support Administration, and service providers just like you folks today. DBHR and ULSA also lead network development activities to provide the support activities and some of the technical assistance to implement some of the strategies and models that we're sharing today. Part of what AmeriGroup does is it really manages the network of the service providers. This includes credentialing, adding service locations for service expansions, participant referrals, the actual authorization of the services, the confirmation of services that agencies provides FCF services in 180-day authorization cycles for payment and services. Part of the critical piece is the credentialing process. Participating providers must be contracted and credentialed. They must notify AmeriGroup if you have any changes in licensure, demographics, or participation status, or to add an additional service location. For service authorization, it really is the responsibility of the provider agency to check the Medicaid eligibility before providing any FCS authorized services. We utilize the Provider One system. It's a database that provides agencies to be able to look up the Medicaid status of a participant. And it's really important to verify that piece of the process before doing any enrollment with FCS. It really speeds up and makes it more congruent in terms of starting services for participants in either the supportive housing or supported employment process. There's also some claims payment and tracking part of the system. The foundational community support is really an integral funding stream, but it's not a sole support system. It really needs to be braided with other financial sources to provide revenue for the program, to develop and expand the services that we're discussing today. There's also a quality management piece. Quality improvement across the systems is really based on data and capacity numbers, and we really use this to better serve the supportive housing and the supported employment Medicaid population. AmeriGroup also hosts a monthly question and answer webinar. These are utilized to provide updates on the FCS programs and really allows different providers to come and ask questions and get updated information from AmeriGroup, plus the Healthcare Authority also participates in those meetings. There's also an advisory council. This has been established to incorporate client voice in the services process and the outcomes that we strive to provide. This advisory council is comprised of enrollees, providers such as yourself, stakeholders, and advocates across the state of Washington. This next slide is about the reimbursement rates for services. The Healthcare Authority and AmeriGroup implemented a fee-for-service rate increase this year during the pandemic to really focus on additional service reimbursement because it's been such a difficult year to adapt to services during the pandemic. As you can see, each program benefit operates on a 180-day authorization cycle. There's also an opportunity to request additional reauthorization for an additional 180-day benefit. The employment services is based on 120 units of service per benefit cycle at a rate of $27 per unit. The supportive housing service is a little bit different and is based on the 180-day cycle, but it's a 30-day cycle of services within that 180-day benefit at a rate of $112 per day. AmeriGroup does send out monthly reports to agencies as a helpful reminder to see which enrollees have an expiring authorization the following month. There is also an exception to the rule, limited extension. AmeriGroup has a separate form to request additional supported employment or supportive housing units above the initial units authorized during a current period of authorization. Additional documentation will be needed to the request. You send this into AmeriGroup. This is just one of the pieces of the reimbursement and billing process. And it's real important for folks to understand as you develop a model around these revenue sources to be able to maximize the revenue and fee for services as you build the team. AmeriGroup has developed a payment process solution, and that's called Availity. Providers can register and enroll in this system, become an administrator in the Availity system, which is AmeriGroup's preferred Medicaid clearinghouse process. The Availity platform is designed to streamline payer activity and allows claims to be filed electronically. There is a guide to registering and submitting claims, and that can be found on the AmeriGroup provider website or through the AmeriGroup FCS contract managers for assistance. Agencies do need to register for electronic fund transfers, EFTs, and electronic remittance devices, ERAs. These are two separate services. And it's real important to be able to work with the FCS managers at AmeriGroup to assist you with any payment activities, stop payment activities, the ability to reissue payments, reviewing denied claims, reprocessing claims through the reconsideration process, as well as providers may appeal the services for an enrollee with written consent from the enrollee. So it's real important as part of the process to be able to have that client voice and make sure they're part of that process for the billing and claim status. Over to the slide for advisory council.
All right. Yeah, Darren has already spoke a little bit about the advisory council through AmeriGroup, but we just wanted to kind of, emphasize how important it is that we get all perspectives around what is going great with this program and what needs, improvement. We're always about quality improvement with our programs at DBHR. And so it's really important that with SCS, we have an advisory council that's comprised of people from all different areas. We want participant voice, we want providers' voice, we want stakeholders, and we want people across the state advocating that want to be part of this program but aren't necessarily an agency. We want their voice as well. So we really want people to think about being part of the advisory council. You don't have to attend in person. It's a virtual thing. You can when they do them in person, which isn't happening right now, but we definitely want people to think about who could be on the advisory council so we can get voices from all perspectives. Next slide, Darren. This is the just the contact and some resource information for AmeriGroup. We do only have Lisa Lorenz's contact information on here, but there are two other AmeriGroup FCS managers. There is Joe Elder and Jacob Avery. You're usually assigned a manager when you start working with AmeriGroup, and they tend to be your contact person, although everyone at AmeriGroup is wonderful and helpful. So we just wanted to make sure you had some contact information. You guys will be receiving these slides after so that you can refer back to some of this information. We encourage that you do connect with them, ask any questions, and if you can't get contacted with someone at AmeriGroup, please let one of us trainers here at DBHR know, and we'll help you get connected to those folks. There's a contact for the TPA. That is, the email or the phone number and way to get referrals in. There is the HCA website for us, and of course, the provider site that has all things FCS on their forms, the provider manual, information about those exception to the rule. So please look at that website and see what you can find. And if you have any questions, let us know. So we're at a point now where if you do have questions right now about AmeriGroup and kind of how that works, we're going to kind of unmute everyone and allow you to ask those questions at this time. So we're going to take 5 minutes and allow you guys to ask any questions you may have around AmeriGroup.
It might be, this is Amanda, it might be easy if you use your hand raising option so that we know you do have a question and have the ability to pull you off of mute as well. I'm afraid to pull everyone off at once. It may become just calamity. So raise your hand, and if you have a question, we'll pull you off mute, and one of us, probably Kimberly, will answer that for you.
Thanks, Amanda.
I would mention too, while folks are thinking about the questions that they might want to ask, that one of the things that happens with AmeriGroup is when you become a contractor with them, they have an orientation with you and go into much greater detail than we have had related to how you interact with them and that kind of thing. Looks like Dennis has a question. Dennis, I believe I've unmuted from this end, so please feel free to talk.
Morning, Don, Kimberly, and all.
Good morning.
Good morning.
Can you hear me okay?
Yep.
Yep.
Great. Anyway, this is Dennis Malmer. I'm the ABHS Compliance and Risk Management Officer responsible for FCS services as we move forward this year. I think I should maybe say this first, is that we certainly wanted to move forward with supported employment and housing last year, but with COVID, it pretty well took the wind out of our sails for sure, but we're ready to move forward in 2021 and really look forward to this evidence-based practice because we know it'll have a significantly positive impact on the outcomes for the clients that we serve. Just in terms of Amerigroup, we do have a contract with them for FCS services. We've worked with Joe Elder, and he is really, really great. HCA should know that. He walked us through an orientation, and because we've been delayed with our implementation, he's willing to do that again in the next month or so, whenever we get ready to employ some additional staff. So just wanted to give Amerigroup a plug and let you know that Joe's done a really good job, and I'm sure the other folks would too, for any of you that are just starting this out. So they've been just really helpful, and we also, just so other folks know too, most of us have electronic health records anymore, and we did follow up with Amerigroup, and they were okay with us converting the Amerigroup FCS forms into templates that work in our electronic health record, because we're going to integrate our housing and employment specialists as a part of the regular routine clinical staff, and so everybody will be working together and have access to all the information, and they'll be able to enter all of our FCS information into the electronic health record as well. We think that'll ultimately help too with any audits or any support we can get from HCA around fidelity. Anyway, just wanted to add that in. Thanks for the opportunity to participate this morning.
Thank
Great
you, Dennis.
information. Thank you so much. Anyone else have questions? Feel free to either raise your hand or type in the chat box, whichever is more comfortable. And it looks like no additional questions.
I think we're good to move on.
Yep, let's do
I
it.
think we are.
Okay, so I guess this is my turn. Hi, everybody. My name is Amanda Polley, and I am a supportive housing program manager for Eastern Washington through DBHR and the Healthcare Authority for Foundational Community Support. So I'm really glad to be here and have an opportunity to speak with all of you. Can you advance the slide forward, please, Darren? Thank you very much. So we're just going to take a moment here to talk a little bit about what SCS is and what it is not. So all of you have the amazing capability of reading, but just in case you want me to smooth it over here for you, let's talk about what it is. SCS is a targeted Medicaid benefit, which is basically there to help participants, or as it says right there, eligible clients, with complex health needs to maintain or obtain housing, as well as maintain or obtain employment. So these are supportive housing services and supported employment services. So what FCS is not is, FCS is not an ongoing payment for housing. We don't pay rent. We don't pay room or board. It's not, we don't pay for costs of housing such as that. It also doesn't pay for wages or wage enhancements for participants. So we're not going to go out there in supported employment land and offer employers, you know, like 50% of their wages instead of them having to pay.
Amanda, did we lose you?
I think we did.
You know, one of the things that I've had to have the most patience about with COVID is all of the virtual platforms that we use at times drop people. And Darren mentioned earlier, I'll mention again, we appreciate your patience. I don't think that I've been in a webinar or a virtual meeting as yet that hasn't had some little bump and obviously we've hit that little bump. So
yeah, her call dropped on, so she told me to take over for her.
that sounds good.
All right. So as Amanda was saying, you know, we're not here to pay wages or enhancements, or it's not an entitlement. It's really about those support services for individuals and making sure that they have support in maintaining or finding and maintaining housing and employment. So let's talk about, next slide, please, Darren. Let's talk about who's eligible to receive FCS benefits. So the first things we're going to go over to qualify are going to be the same for supported employment and supported housing. So a person needs to be able to qualify for Medicaid. We cannot enroll someone in the foundational community supports until they have Medicaid. So if they are somebody who qualifies, they would need to get on Medicaid before we could authorize them for services. The next requirements are someone would need to have a complex health need. So that means they have a mental health diagnosis, SUD, or a medical necessity related to, you know, activities of daily living, needing support, can't live independently. So if they meet one of those health needs, then we can move on to that risk factor. As for supportive housing, an individual does need to be 18 years or older because you cannot sign a lease until you're 18. But for supported employment, we're able to serve people 16 and above, as that's when you can start becoming employed. So we're really excited about that. And now we can talk about the next point, which is the risk factors. Next slide, please.
Thank you, Kimberly. This is Amanda. I just want to say thank you for picking that up. My phone just dropped completely. So I appreciate that.
No worries. I think we actually are missing a slide on the risk factors. I just realized that.
Oh, well, we'll make sure we add it in before we send these slides out so that everybody has those as well.
So I'm going to go over the risk factors for supportive housing, and then Darren or Dawn, do you guys want to go over the risk factors for supported employment? So for supportive housing, once they meet one of those medical needs, if they meet the SUD, mental health diagnosis, or need for help with activities of daily living or those risk factors, now we can move on to the other thing, which is whether they have that additional risk factor, which is chronic homelessness. So that would be someone that meets the HUD definition of chronic homelessness. That's 12 months consecutively or 4 episodes in a 3-year period that meet that 12 months. I do want to mention with the chronic homelessness, if someone meets that risk factor and they are not able to prove that through having gone through coordinated entry or working with a shelter or some provider, there is a self-attestation form that they can fill out to prove that they've been homeless that period of time. So we just want to make sure that that is available to them, because we know a lot of folks are not necessarily living in a shelter or staying with somebody that can attest to that. The next one would be someone that has gone through caregivers more than 3 times in a 2-year period. They are someone that's firing their caregivers or it's just not working out. And so somebody that would need that kind of level of support would be eligible for our services. Somebody who has been in an inpatient setting multiple times in a year. So if they're living in that nursing facility or some kind of residential, that would be someone that would be eligible for our services. Another is if somebody's in the state institution or incarceration from twice in a year, sorry, my words are going over, they would be eligible for those services. Amanda, am I forgetting one? I feel like I'm forgetting one.
I don't think so. I don't think so, but let me pull up another slide and we'll shove it through just to be safe.
Dawn or Darren, do you want to talk about the employment risk factors?
Absolutely, I can do that. So related to supported employment, one of the risk factors is unable to be gainfully employed for at least 90 consecutive days due to a mental or physical impairment. And as an example, they have the individual's been assessed and determined eligible for HEN or ABD program. Folks on HEN and ABD end up being typically, as long as they have the other factors, other criteria that they meet, they're typically eligible. Another risk factor, SUD with repeated treatment episodes, which is 2 or more instances of substance use treatment in the past 2 years. Risk factor of being diagnosed with mental health and or substance use disorder that is at risk of deteriorating without intervention. And then as examples, they have social isolation resulting from criminal justice involvement, homelessness or poverty, etc. Care for condition that requires multiple provider types, history of psychiatric treatment that requires continuation, and cannot maintain roles in employment or education resulting in past termination expulsions, which I think is one of the ones that's very often pulled from in order to prove that risk factor. And then an inability to obtain or maintain employment resulting from age, physical disability, or traumatic brain injury. And those end up being very often the folks that are being served by ALTSA and referrals from ALTSA. Kimberly and Amanda, did you want to speak more to risk factors for supportive housing, or shall we move on to the FCS referral?
Yeah, I will say something. Yeah, there are going to be certain populations like the folks that do go through in-home caregivers that would be possibly being referred through the ALTSA area. So, and we want to say that ALTSA does do their referrals slightly different, and I think someone's about ready to talk about how referrals happen. So, we do have different pieces of FCS, and ALTSA does things just slightly different in the way that they refer folks to AmeriGroup.
Allison, I do see that you asked, is there a slide to show the risk factors? We will send out an attachment of one of the forms that is available, and I'm looking at the title of it now, the quick reference guide, the FCS quick reference guide. We will include that when we send out the slides after the fact.
I can also, sorry to interrupt, Amanda, I can also put it in the upload section while this is going on, so everybody has an opportunity to download it in the download forms while this is still going on. So I'll do that now.
Good. Thanks, Amanda. So Darren, I think we're on to you.
Okay, thank you, Don. Thank you all. So FCS referrals, definitely this process is, there's no wrong way to make a referral for this program. AmeriGroup FCS has created multiple pathways to get people into the program for the services, which has been very convenient and fairly quick to get people going. An enrollee or somebody who just wants supportive housing or supportive employment service can complete the referral form. There might be a family member or a person from their support network that could help facilitate the referral. And I was just talking to somebody at a shelter in Skagit County and just talking to some of the volunteers and people at the shelter that could actually help with the participant to fill out the form so that they could send that directly to AmeriGroup, and then they can kind of look at the demographics and the providers in that area to assist with the referral. A lot of providers create, robust referrals because they can add some additional documentation to support those different, the risk factors and those health factors. Aging and long-term support, they definitely have a very robust process for eligibility within their system. I was just meeting with an ALTSA staff the other day, and it's like 20 pages. So definitely they have, more information that they look at and pull that has a lot more health criteria. Plus that they're looking at some of the PRISM scores, the Risk Intelligence System PRISM score, and how that scores and how that facilitates referral into the system.
Darren?
As trainer.
Darren, excuse me.
Yes.
I'm not sure if the slides are frozen. Can you check to see if you can advance to the slide that you're talking about, please?
I have ST referrals that anyone can refer a potential enrollee. Is that showing now?
I apologize. It is. I was thinking you were on the next slide.
Oh, yeah, I'm just getting to that one. Thank you, Don.
That's my error in regards to notes that I have about who's presenting which. My fault.
No, that's keeping me on task. Thank you. So this is kind of a visual overview of the FCS process to see where the process can go. And the most important thing is getting this information to AmeriGroup, and it can come from any point in the process to get folks going and to really have that ability to verify the Medicaid health benefit for that eligibility and that determination for FCS to go ahead and AmeriGroup to provide the service authorization for those services. Definitely AmeriGroup has quick reference guides and a lot of forms on their website that are really helpful tools. And it was great to hear that, Dennis, that you were able to make templates to incorporate into your electronic health system that just really creates that system where multiple people have access to forms and can share across platforms. I think that's a great way to, adapt and implement these tools into the current systems that are used for supportive employment and for supportive housing. So in my experience, when I was working on the behavioral health side, I worked quite a bit with Lisa in terms of they're always available and they have great response rates to questions and asking for assistance and looking over forms. There are times where they do ask for additional information for clarification and support, and sometimes we had to add additional documentation to document that mental health, that behavioral health, that SUD challenge that somebody might be facing in their life, or in terms of some health conditions as well. So definitely I just want to really, that's an open pathway just for collaboration and get clarification for AmeriGroup that they do have a lot of information on their website, and they're very helpful in terms of talking to. And they're also very great during the Q&A sessions to kind of address some of these questions and some of the challenges that might come up during the referral process. I think over to you, Kimberly.
All right, thanks, Darren. So we're going to talk a little bit about what the benefits are through foundational community supports, and I'm just going to go over the supportive housing. Again, this is really about the support services for an individual. So we are there to help them find and maintain housing. So that can be those pre-tenancy and tenancy sustaining services. That's going to include things like providing housing assessments to find out what they want and need in housing, talk about what that looks like for them. We're going to be doing a lot of outreach to landlords. So part of the job for a supportive housing specialist is to get out and meet those landlords, build those relationships so that we have housing stock for our individuals to access out in the community. We're also going to connect with community resources and really get people, we have to connect them to other things. I always say it takes a village to house somebody. And so that means that we need those other agencies to partner with to make sure that folks are connected to other resources and get that wraparound support that we hope that they get. Assistance with housing applications. So we're going to be doing a lot of whatever it takes to get someone into housing. That's such a wide range, and I could probably talk all day about what that would include. But things like rental applications, getting them connected to benefits, talking to them about what they don't have to get those things. So maybe they need a driver's license, or they don't have their social security card. So we're going to be doing all of those kinds of things to support them and help them along the way. And then, of course, we want to get people connected to employment and education. We're going to teach them how to be good advocates for themselves teach them how to be a good neighbor, work with them on life skills, really helping them learn how to take care of a place and themselves while they're living in their home. So this is just a piece of it. I think we're going to go into this in more depth in a little while, and I'm going to turn it over to Dawn.
Kimberly, you're absolutely right. We're going to go into probably a lot greater detail in just a bit. But just kind of a brief overview related to supported employment and the benefits available through foundational community supports. It is about finding a job and maintaining a job. And so part of that finding a job process where it talks about discovery or assessment, you have to get to know the person with whom you're working in order to be able to help to make a good job match and to know what kind of supports are going to be needed in order for them to succeed. Supported employment isn't just about finding a job and saying, see ya, good luck. At times, it's also about career advancements. The hope is that at the end of things, the person has a job that's sustainable over time, which means they got to like it, which means it's got to be a good fit. And sometimes that job that they get is not the job that they're going to keep long term. We've all been through that, where none of us in the first job that we ever got. And so career advancement really is part of supported employment, including helping people to determine if education is going to be needed, additional education is going to be needed in order to move forward. Individualized job development and placement. Kimberly mentioned that staff in housing go out and talk to landlords. Staff in supported employment go out and talk to employers. And when I say go out and talk to, obviously during COVID, that's been an impossibility at times. Contacts have been via telephone or email or those kinds of things. When COVID restrictions lift, it really is about going out and talking to employers. Ongoing follow-along supports at the frequency and the type that people need. Negotiation with following along supports to employers. Sometimes employment specialists talk about accommodations and that kind of thing. Job coaching. Not everybody on our caseloads ends up being somebody that can learn a job just through the traditional methods. And then benefit support, training, and planning. One of the primary reasons that people with disabilities cite for not becoming employed is fear of losing their benefits. And so it's incredibly important from the beginning to help people to understand what's going to happen to their benefits if they work. And also not to hold them back from potentially working their way off of benefits. If a person has a job that pays a wage that supplants what those benefits were, and in a lot of cases it's going to be more than that, then it makes sense for them to work off their benefits if they feel that they can do that. Darren, next slide, please. This time I'm paying attention. I apologize. So this is a great time to just kind of summarize the kind of what we've discussed earlier today by having you ask questions if there's anything that needs further clarification. So I would ask you to think about any questions you might have. I'll point out too, if you look at the handouts section in the window that shows what, the different aspects of the webinar that Amanda has downloaded for handouts that you are able to, or she's uploaded, that you're able to download in order to have the information that was asked earlier about risk factors and that kind of thing. Thank you, Amanda, for doing that. So please feel free, if you have questions, to either raise your hand or to type in the chat box. And it looks like I don't see any questions as yet or hands raised. Our intent today is to give you an overview. There is a huge amount of information related to foundational community supports. Our intent is not to inundate. Lessons learned from last year when we did this kind of process, we threw a lot of information at agencies kind of, right off the bat, and it was a little, I think, overwhelming, which we're trying not to do this time. But I do want to make you aware of the fact, if you feel like you have questions that you can't answer during this session, the four of us are very willing to set up individual training sessions with your agency should there be a need. So these webinars we're presenting as part of the grant are not the end of things. As a group, we host webinars throughout the month. We have a topical employment and topical housing webinar each month. We have a job developers community of practice webinar each month. We have a supervisory webinar each month, and they alternate between supported housing and supported employment. Those are training that will be available to you and your staff. Individualized training as per your needs. All you need to do is let us know that you have additional questions and we can set up with you. Will be available to you. And then there are a variety of we call them limited series webinars that we will be doing as well. Pat Tucker, who some of you may know, is going to be doing a series of webinars for supported employment, one on job development, one on job retention, and they'll be repeated periodically throughout the year. So there are all those tools that are available to you. We hope you get a lot out of the webinar today, but if it ends up being a little overwhelming, just be aware that we can provide additional assistance as needed. So I'm still not seeing any questions or hands raised. So what I would say is it's time for a 10-minute break. So let's come back at 10:05, if you would please, and we'll get started again at that point in time. Oh, I do see one question. If an individual wants advancement in training, how much can we pay for the advancement? So if you're talking about a person on a caseload that wants to have a career that requires education, typically what the supported employment specialist would do would be to help them to apply for FAFSA. And during that process, it also includes the Washington State Need Grant. So agencies don't actually potentially pay anything. They may help with assistance to apply for FAFSA. They may help to assist people to sign up for DVR. And if they are eligible, Division of Voc Rehab has been known to pay for education. Once again, they expect that the person will sign up for FAFSA. So if they don't qualify for FAFSA, and if the type of job they want to do relates to their long-term career goal, then DVR has been known to pay for education too. I hope that answers your question, Elle. So do please take a break. Be back by 10:05. Thank you. welcome back, everybody. I see we're at a 10:04, so we're just about at a point of starting up again. I would ask one more time if there are any questions that folks have. And if they do, now's still a great time to ask them. Very honestly, now and any other time you might like to.
Good one, Dawn.
So what we're going to be doing is talk about individual placement and support model for supported employment. Our supportive housing colleagues will discuss supportive housing after this. And so we're going to start back up here after the break with talking about IPS, individual placement support, supported employment. Next slide, please, Darren. And thankfully, coffee is kicking in, so maybe I'll do a better job now. So this says AmeriGroup contracted services. In the first couple of slides, in fact, that's what they are. I think you heard, it was either Amanda or Kimberly said it, talked about tenancy and pre-tenancy kinds of services. Within the AmeriGroup contract for supported employment, it's pre-employment and employment sustaining services. And you'll see in the list of services within the contract, the job-related discovery or assessment. Anyone who's actually worked in the past with people through the DDA system, if they've had a contract to be a supported employment contractor through the DDA system, you'll recognize the term discovery. Assessment in relationship to individual placement and support is actually a career profile, which we'll talk about in greater detail. But it's what I mentioned earlier, it's the intent to really get to know the person well so that you can make a good job match, so you know what they want to do, so that you know what supports they need and that kind of thing. Each agency that does supported employment is required to do person-centered employment planning. And that is exactly what it sounds like, very honestly. You sit with the person, you sit with anyone that might be a natural support to them that they allow to attend the service planning session. You sit with, hopefully, the other service providers that are providing services to them, whether it's a therapist or a case manager or housing person or whatever. And you come up with the plan for what it is that they want to do. They're the driver. I had somebody on my caseload once say, so it's like, I'm the driver and you're the GPS, right? And I said, that's actually a really good analogy. I can give you suggestions as far as where to go, but you're the one that decides whether to take them. So this person-centered employment planning, you get to be the GPS. Individualized job development and placement. We're going to talk about once again in greater detail, but just be aware that it really does require going out and talking to employers. Job carving or customized employment. I think the terminology years ago used to be job carving. I think it's moving more towards customized employment, and I know DVR uses that terminology. The intent is getting to know the person and also getting to know the employer well enough that if a person can't just slide into a job description the way that it is, sometimes we carve out a piece of a job that a person would do incredibly well, and that's a need for the employer, and that's what the customized employment or job carving is about. Benefits and education and counseling. A lot of agencies do not have a benefits planner on staff. I will mention here, we'll mention again, the DSHS Pathways to Employment website has what's called a Benefits Estimator, which is a great place to start. It doesn't take the place of benefits planning, and it'll show up on your resource list. So I'm mentioning it now, and once again, we'll mention again. If you're like me, it takes hearing things at least a couple of times to remember. But that Pathways to Employment website and the Benefits Estimator is a good start. And then AmeriGroup maintains a list of certified benefits planners that agencies can contract with. And I believe they'll talk to you about that in their orientation. If they don't, let us know, and we can help you get connected with that information. Transportation. Has anybody heard the terminology windshield time? I know when I provided services, a lot of the sessions that I did were provided in transportation with the person. So rather than doing the session in an office or someplace else, we were doing it in the car. So that's where it says only in conjunction with an authorized service. Rapport building, can't do the service without it. Supported education was what I mentioned, part of what I mentioned to Elle when he asked the question, when the question was asked, I should say, related to paying for education. Supported education is a piece of supported employment and includes things like applying for FAFSA, like helping people with anxiety to perhaps become acclimated to either the campus or the virtual system they're going to use, or things along that line. Helps you identify potential barriers in order to come up with solutions, essentially, prior to job start. One of the things that IPS encourages is a job support plan that we actually don't wait until they start the job to end up developing. We develop it from the beginning. So if you know a person has no ID or no Social Security card, that may be something you're working with them on from the beginning. And then collaborating with support teams. I know a lot of the people with whom we work may have burned enough bridges that they don't have natural supports at this point in time. They don't have family that wants to remain connected with them. And so a big part of what we're doing is helping to build that team around them and hopefully helping them over time to identify who might be natural supports within their life. Next slide, please, Darren. So one of the other pieces of the AmeriGroup contract are employment sustaining services. I mentioned earlier career advancement. It was pretty, I'm going to back up for just a second and say that I worked for a behavioral health agency for 21 years and did supported employment during that period of time. And so I have practical experience in providing the services. And in relationship to career advancement, we would end up with a lot of people that came in our door that said, I just need a job so that I can keep a roof over my head, or feed my kids, or whatever it is, all the basic things we do. And we would help them do that. But they would have a longer term goal of something that was going to require some education or some additional effort before getting into that long-term job. And so we were able to help to get them in a job and then start focusing on, in addition to the support we gave them for the current job that they're in, start focusing on what steps do you need to take to continue moving forward with your long-term goal. Negotiation with employers, job accommodations, and assistive technology. Sometimes that's things that we can do on our own, or with, say, accessing things like the Job Accommodation Network, which is an amazing resource. And if it's one you're interested in, I'll share that contact information with you. Sometimes it's the kind of thing that would warrant a referral to the Division of Vocational Rehabilitation so that they can help with assistive technology and things like that if a person qualifies for their services. Job analysis, meaning essentially just that, analyzing the job and actually making that match of the job needs with the skills of the person that you're helping to find a job. Job coaching can be on-site or off-site. It can be checking in with a person after their shift, or it can be being on-site and learning the job with them and then helping to support them. Not so much to teach them the job, but to teach them when and how to ask their employer for help if they don't know what they're doing. We don't ever want to create dependence upon us. We want to help the person to learn how to be more independent, which includes, when do I ask my employer or supervisor for help? Benefits, education, and planning, we talked about. Transportation, we talked about. Asset development, meaning the financial kind of asset, but also the personal kind of assets. Almost every job one might do requires some level of computer technology these days. Even if you're a janitor, which these days is an incredibly important job with the sanitizing that needs to be done with the COVID, even a janitor has to be able to keep track of supplies that need to be purchased by using a computer, or perhaps communicate with their supervisor that way. So asset development can be learning skills like that. And then follow along supports make or break the job at times. We've all gone into a new job where you have a honeymoon period, which ends, and then the real work begins. And those follow along supports kind of help at when that real work begins, when perhaps you're not still just in that learning curve, and now you've got some expectations put upon you and you need to be able to perform. I think that's when sometimes people run into difficulties. Next slide, please, Darren. And I think over to you for the first half.
Thank you, Dawn, and welcome back, everybody. This is an overview of our 8 principles of the supported employment model. And I just want to say that there's a lot of moving components to this model. Just in the 2 prior slides that Dawn discussed with the pre and the post services, there's a lot of different services that make up supporting somebody in their journey to employment or education or career advancement or just keeping the job that they currently have. As trainers, Dawn and I, our goal is to be a source of education and assistance to implement these principles. This is only 8, but the IPS model has a total of 25 different elements that we work with different agencies through our learning collaborative to learn and implement the process over time. And we're addressing this to the executive leadership today because all of these elements take time and resources, and it's the first stage of a real culture change at an organization. My background is in behavioral health as well, and it takes a lot of time to change a culture and to really focus on the elements that we're presenting today. The individual placement and support model was originally developed by Deborah Becker and Robert Drake and was studied and validated with people with serious mental illness, as well as people including those impacted by co-occurring substance use disorders. There were 28 random trial studies. 27 of the 28 studies demonstrated a significant outcome in employment, 55% for IPS and 25% for controlled sites. And I just share this information because that's pretty significant in terms of using this model. We're really focusing on this first stage. The competitive employment is the goal for our Medicaid eligible participants. Oh, can you still hear me? Okay. So this first stage is that we really want the employment staff in the agency to focus on competitive employment, wages, integrated community setting. This is not putting people into volunteer positions, having extended work-based assessments, completing work inventory activities, or other actions that really limit the access to the job seeker, meeting employers in the job search process. This journey, as described earlier, is really, client, individual, job seeker focus. And the job seeker has that choice, as Dawn mentioned, that they're really in the driver's seat to guide the process. That might mean there's additional research and education as an employment specialist or the employment services program might be able to provide the job seeker, but it's that partnership to really get them into that competitive employment. Part of this also looks at the job strategies and the personal work strengths that the job seeker brings into the program. Another component of this is that people with lived experience have a wealth of information to share. And part of the strategy of competitive employment is to really have an opportunity to share those stories. It may be during onboarding process where HR or the CEO might talk about success stories that the program has about the transformation of employment or the transformation of permanent housing those milestones shared across the organization can be very valuable to change the culture and really validate the change and success that people are having in the program. Another important component to competitive employment is data and metrics. Using data in the business is really crucial to evaluation of the success and be able to gather information to make changes, to identify what is working and maybe what some of the potential barriers are. And when we have those type of information, it's really critical for that executive leadership to have access to the employment services program staff to talk about some of those barriers and challenges that they face, and maybe potential changes that can be implemented, either tracking metrics and key performance indicators, and then share some of that data and the information across platforms, across programs, across all the staff in the organization, to really have that level of transparency as we move the culture of the organization to focus on competitive employment as a goal of the supportive employment program. Another key element is the integration with treatment. To really reach a high level of integration and programming, employment specialists really need to have access to other clinicians, treatment staff, specialists, either in the behavioral health side or the substance use disorder clinicians through team meetings. And this is above and beyond email, texting, phone calls, meetings of that nature. IPS is really specific in terms of meeting a high level of fidelity in the program is through weekly team meeting contact with other providers and other service agencies or teams within the organization. This really allows the employment staff as well as the other staff to learn about the job seeker and really learn about potential barriers or changes that could be helpful or maybe detrimental to this process we call employment. And hopefully through bringing people together, there's more shared decision making across the rehabilitation process. It's really a holistic approach to supporting the job seeker and supporting them during their recovery process, from behavioral health, from homelessness, to addictions, to substance use disorder, many different challenges that the job seeker faces, going back into employment. Another key critical piece is what we call in IPS zero exclusion. And this just refocuses the attention that there's no barriers to someone accessing the employment services, that it's really about personal choice, whether somebody might be involved with the justice system, they might have cognitive impairments, they may have just been recently psychiatric hospitalized, they might have episodes of crisis, they might have difficulty managing their medications and consequently managing their symptoms. We want this process to be fluid and to take any speed bumps or barriers out of that referral process. We really want to honor that choice of the individual saying, I'm ready to work, or I want to return to employment, or I want to return to school, to have that focus on inclusion in the community. As we know, this year has really demonstrated that we have all been exposed to trauma and we've all reacted in different ways. One of the barriers to employment is being more remote, which has been a very helpful process and strategy to continue to provide services. And I know providers across the state have also adapted this depending on where the Department of Health regulations and safety protocols have been, but we've all been able to adapt and still provide, services to folks through changes. And change is a natural part of the system, and we just want to make sure we take away those preconceived barriers from the onset of providing services so that there's this fluid flow of people joining into that employment search process. This is just a real core philosophy of the IPS model, that anybody with a disability or anybody with a challenge or anybody who has experienced trauma or abuse can be employed or can enter into the education system and be in their community. So agencies, you know, it's really changing some of the culture of the organization and kind of focus on these different elements of the IPS model so that it's talked about and shared, but also share some of those success stories. Because if we're able to kind of really honor that peer recovery process, we can have them more integrated within the management system to honor that process and really acknowledge those successes and share them internally, and hopefully have that process to share success, in terms of the stakeholders that we all work with to provide services. And again, you know, we've talked about this in other slides, and I've mentioned it before, is that this whole model is really based on client preferences, that it's on the individual choice, as Dawn had provided some examples. And even in our role as fidelity trainers, that we hear stories from different agencies, and we really see that somebody might have a job goal or a career goal. And then the employment specialist really spent a lot of time doing the research to see what it really takes, and then share that kind of information with the job seeker so that they can choose. Maybe they need some further education, or maybe they need to reevaluate the time and the energy it might take to get certified, or look at some of their work history, see if there's those transferable skills, and add those additional skills that they can be marketable in that field. And as Dawn mentioned, that preferences are honored, and somebody might need a survival job right now to just make ends meet or support their family. And then the employment specialist can still provide that focused survival job piece, but also continue to look at other resources. There was one program that somebody wanted to work in the auto detailing business, but he also needed a survival job, so they were able to get into the food service industry. But the employment specialist kept looking at that auto detailing piece until they were able to find a job that fit the individual's needs. So it's definitely a process, and we're aware of things change, and those can be challenging for people. But underlying, we all want to look at those natural supports and be as supportive as we can to those goals that the individual brings to the table. And definitely a part of this is also disclosure. We don't want to be going out there and discussing some of the client's history or goals without having that conversation initially with the job seeker, so that we know information that's shared and have the appropriate releases signed for that. But definitely we're focused on those skills and abilities and the individual choice as we move out into the community and make some of those goals be successful employment in this case. So I'm going to share some of the 8 principles time with you, and I'm going to switch these over to Dawn to talk about the next 4 phases of and principles of supportive employment.
Sounds good. Thanks, Darren. So I think before I get started on that, one of the things that as an executive or leadership team is going to either be driven by you or developed by you is when you look at the principles of supported employment and supported education for that matter, it's important to look at each of the principles and determine, have you got some kind of documentation to support that you're doing it? And so when I go into agencies and I do training, I will typically talk about, let's look at the 25 principles, and these 8 categories kind of summarize them, but the 25 principles and how do you document each one of them. Benefits planning and education is one of the important principles. And I mentioned already the pathways to employment and the fact that they have a benefits estimator. We checked with the folks who developed IPS and asked if that would be something that they would typically see as meeting that principle. And so it's important for the staff to know that they can and probably should access that pathways to employment to look at the benefits estimator. It'll do a couple of things. One is that it's going to give the person that's receiving the services some kind of education related to what will happen to their benefits when they become employed. The other thing is it begins to provide training for the staff person about what benefits mean. I've done fidelity reviews here recently where somebody has said, yeah, SSI, SSDI. Yeah, that's a piece of it. What happens if the person has a housing subsidy? What happens when they have food and medical? What happens if they have VA benefits? What happens if there are a variety of things like that? Does the staff know enough to know when they've got to seek additional assistance in order to make it through that? And the principle, and I'm going to go ahead and read from the principle for just a second. The principle related to benefits, or they call it work incentive planning, in the fidelity scale, which I will tell you, share with you so you can get a start on making sure that you have documentation to meet each of the principles. But in order to get a 5, and on the supported employment fidelity scale, the 25 items are rated 1 through 5, but in order to get the highest score, it says employment specialist or other mental health practitioner offers client assistance in obtaining comprehensive, individualized work incentive planning by a specially trained work incentives planner prior to starting a job. They also facilitate access to work incentives planning when client needs to make decisions about changes in work hours and pay. Clients are provided information and assistance about reporting earnings to Social Security Administration, housing programs, etc., depending upon the person's benefits. So it isn't even just the education related to work incentives planning. It's also recognizing that folks may need help reporting those benefits so that they don't lose them. Do you have a system in place for doing that? Have staff been trained in order to do that? Have you contracted with a benefits planner that can kind of pull that up to your radar? Really important stuff to be aware of because it is one of the primary reasons people decide to not seek employment. The truth of the matter is, SSI and SSDI always doom the person to poverty. Another truth of the matter is, why wouldn't you want for the folks that we're serving the same kinds of things as we enjoy? A person can make so much more and can have so much more in the way of assets if they're working as opposed to just being on SSI and SSDI. And I'm going to get on my soapbox just a little bit. I know you've all heard Social Security is going to dry up. Guess what will dry up with it? Social Security disability insurance, which is what people get if they have a work history and they're on disability as being unable to work at this point in time. And they say unable, that's really kind of a misstatement. SSI, taxpayer program, which I have seen in years past on the governor's budget being something that's been addressed as far as, cuts to the piece that the state has some piece of. So we don't do people a service by letting them think that SSI and SSDI are their forever sources of income. How much better is it if they have control over that by working? So off my soapbox, sorry. Rapid job search. I've done supported employment for long enough that I remember, I'm going to call them the old days, when there were things like sheltered workshops where people went there and all of their colleagues were also people with disabilities. Sometimes they got paid a piece rate. Sometimes they got paid a percentage of what, quote, the normal person would get paid, and there is no such thing as normal in my mind. We all have our differing disabilities, if you will. Up through the present, where people have choice and they're placed in competitive jobs that anybody else could have, and and paying a wage that's at least minimum wage or higher, and that kind of thing. We take them seriously when we do the rapid job search. old days, once again, a person would get into a program and then they were expected to go through a resume class and an interviewing class and a lengthy assessment and a this and a that. That's not what we did when we got our jobs, or at least probably not. We tried out a job. If it worked and we loved it, great. If we hated it, we moved on. And that's essentially what IPS kind of points towards when they're talking about rapid job search. Get a person in a job, see how they do. That's your assessment. That's their assessment, self-assessment. So the rapid job search is really about getting people in front of an employer within 30 days. That doesn't mean they get a job within 30 days. It means they get in front of an employer within 30 days, potentially as part of their research process in regards to what it is that they want to do. And so the standard actually talks about either the person or the staff person needs to get in front of, the person on the caseload or the staff person needs to get in front of an employer within 30 days for highest fidelity. That would be a 5. That would be your score of 5. I know with COVID, they're not necessarily face-to-face getting in front of employers. And this doesn't refer to online job search and filling out applications online. It's actual some kind of in-person contact. And by in-person, I either mean phone, face-to-face, Zoom, whatever we're able to do at this point in time. That has to happen by either the person or the employment specialist, or both. I think the best case scenario, I had a gal on my caseload one time that talked about her low self-confidence days. We would go out and talk to employers together. And she'd tell me I'm having a low self-confidence day. And so I would talk to the employer. She would observe to be learning kind of questions to ask, how to approach, that kind of thing. On her high self-confidence days, sometimes she'd say, you can stay in the car. And she would go in and talk to employers on her own. But it helped her over a period of time to gain the confidence to talk to employers and start to do her own job search. In order to do that rapid job search and keep track of it, here's the documentation piece. There's got to be some kind of log. And I'm going to put in a plea, if you will. When I do fidelity reviews, I know when Darren does fidelity reviews, sometimes agencies have their staff document employer contacts in progress notes. There is a principle that says that supported employment specialists should do 6 employer contacts per week that they document. It doesn't have to be 6 per every person on their caseload, it's just 6 for somebody on their caseload. If you have to go through progress notes and find that, it's almost impossible to count up, did this employment specialist do 6? So what's really helpful is a log where all employment specialists put their contact information with an employer in that one log. The other thing it does for supervisors is it cuts down their time being able to track what's going on immensely. As a supervisor, if I had to go through every progress note to figure out how many contacts an employment specialist made that I'm supervising, that wouldn't last long. It wouldn't happen as regularly as it needs to, as opposed to a log where you can look at the line items, the rows, and count 1, 2, 3, 4, 5, 6, and say, yep, they did it, and know that that was the case. Huge difference. And so I'm going to really strongly encourage, as you develop the documentation for what you're doing, come up with a job log. If you need more feedback about what it should contain, we can send samples to you. Systematic job development. IPS, in my mind, is really an amazing thing because a lot of it's common sense. We develop relationships with the people on our caseload so that we get to know them well enough to know what might work for them. And as we're doing that follow-along support, if the job isn't the right one, we talk about lessons learned for the next time we do job development. We don't just say, well, you had your job, you're done. It's that one was a good trial. You know what you like, you know what you don't now, and let's move on to the next one. IPS is also about relationship building with employers. How do you ever get to the point of that job carving or that customized employment unless you know an employer and you know what their needs are? And so we're matchmakers when we do job development. We're matching a person and their great skills with an employer and their need. We are not ever, and I know new employment specialists may tend to say, I work with people with disabilities and you need to hire them, kind of thing, kind of making a plea towards a philanthropic sort of a deed by hiring them. That doesn't work. Employers want to hire good employees. They want to hire people with skills. And I can guarantee that the people on caseloads have skills, lots of skills. It's a matter of figuring out what they are and then sharing those with the employers that might hire them. So the systematic job development starts out with an employment specialist talking to the employer about what is it that you need, Mr. Employer, and listening very closely for what they've said related to what it is that they need, and then determining if they have somebody on their caseload that would be a good fit. If that specific employment specialist doesn't have somebody that would be a good fit, and there's more than one employment specialist, part of the intent is to go back to the team meeting and say, I found a job at ABC Widget doing such and such. I don't have a person on my caseload. Does somebody else have one? You want to be that hero for the employer regardless. That's part of building that relationship. You want to help them to get that good employee, whether it's somebody on your caseload or somebody on one of your colleagues' caseloads. So part of that systematic job development is that piece as well, coming back to the team meeting, discussing job openings. It also impacts the rapid job search piece of things. If you've gone out and talked to an employer and don't have someone on your caseload that would be a good fit and someone else does, that person on their caseload has ended up getting a job, which also impacts that rapid job search situation. So systematic job development, very often an employment specialist on second or third visit, after they've heard what the employer has to say, after they've maybe gotten a tour, hopefully, of the place of employment, is able to go back and say, you know, I have somebody that I think would be a good fit because of their skills, because their skill set sounds like what you need. It isn't a focus on, you're not selling a disability, you're selling a person's skills. And that's the way that we talk to employment specialists about doing the systematic job development, to sell the person's skills. Not that we're going to fail to acknowledge if they have a disability that requires an accommodation, but that first or second visit with the employer is not necessarily the time to do that. This brings up, and over the years, I've gone to lots of training too, learned tidbits here and there. University of Washington has a program called Center for Continuing Education and Rehabilitation. They were the ones that actually started the job development community of practice call that now we've taken on. And one of the things that they said early on was, pay attention to what your business card and your brochures say. Speak employer speak. Don't say that I do job coaching. You mentor folks. Don't say that you're an employment specialist. You're an employment consultant, much like the temp agencies said, or temp agencies have. So they talked a lot about speaking employer speak, getting to know the employer, and that kind of thing. And one of the things they mentioned is, what do you put on your business card? If you put XYZ SUD agency, are there employers that are going to shut the door just based on that? Yes, there are. Is it being dishonest to put XYZ employment program? That's your determination to make, not mine. But it's something to consider. You know, spend some time thinking about what you want to call the employment program, and what you want to put on your brochures and your business cards and that kind of thing as part of the documentation and determining what needs to happen. Time unlimited support. One of the things that makes IPS successful that the old school kinds of things didn't have is the fact that the person's supported as long as they need it. And the nice thing about AmeriGroup and the system is that you get reauthorizations for every 6 months that a person needs them. But you can also get exception to the rule kinds of extensions. And what that means is, if a person's used up all the units in 6 months, they can have more if there's a bona fide documented need. Once again, here's your documentation. And so these time unlimited supports really can happen with people that are on FCS, supported employment services, as long as it's well documented as a need. So that extension allows you to get additional units of service within the 6-month period that you're in. The time unlimited supports really are about a couple of things. One, it's about supporting the person. The other thing is it's about potentially supporting the employer. Darren mentioned earlier release of information. One of the important principles within individual placement and support is talking with people on the caseload about disclosure. And I think, if you have time, look up Jeff Waghorn and kind of his discussions about disclosure. I think this is one of the things that's going to evolve from the old days until, up to something a little more current. We all share personal information on a regular basis, and we decide what and how much and to whom. The people on our caseloads deserve to have the conversation that allows it to go that way too. Disclosure makes it sound like we're sharing some big hairy secret, when in fact what we're doing is we're talking about personal information, how much is going to be shared and with whom. And so part of the time unlimited support is talking with them about, can I help you at the place of employment if the employer agrees? Are you willing to sign off on that release of information with the employer so that we can go in and do those supports? Sometimes people will say no because they're fearful. If somebody asked me, can I share information about your disabilities, I would have to say no at that point in time. If they ask me, can I share that you have an anxiety disorder, and if you could take a brief break just to kind of breathe and pull it back together again, like I did today during our break, then I would potentially say yes. So a lot of it is how we present those kinds of things. And a piece of that time unlimited support is, if the person really has some significant needs, talking with them about exactly what you're going to share. No, I'm not going to tell them you have schizophrenia. What I am going to say is you have some difficulties kind of, drowning out the outside noise. So if you could wear headphones, that would be a great thing. Is that permissible? Or difficulties with organizing, and a checklist takes care of that. Is that something you could support? So part of that time unlimited support is that disclosure conversation more than once, because job duties change and job search changes. And discussing, here are the things that I want to say to the employer. Is that okay with you? And being pretty specific about it. So that's part of the time unlimited supports too. So I think that brings me to the end of what I want to discuss at this point in time. Darren, did you have anything that you wanted to add? Did I miss anything?
Well, I didn't think you missed anything, and always some great reflections on, the journey and the process, and sometimes when, the principles kind of meet the road, out there in the community. So I think you did a great job, and some of the robust stories are always good, because I think this is, one of those potential models for, supportive employment and supportive housing, where you can have some really robust stories of people who have faced just horrendous challenges, and they can also change their lives at the same time. And at the former agency I used to work with, it was incredible to see the integration of supportive employment services into the new SUD program at the time that was developing and initiating, focusing on employment, which already, is within some of the SUD principles in recovery, and then to do the integration with the team and really focus on, that employment piece. So it just can be a really robust time to have and really emphasize the changes in people's lives, because there's a lot of great success. And if we just look at, that human potential piece, this transformation process, I think it really empowers us all to do that. And I think I've really seen some of that when we have people who have that lived experience and they want to become certified peer counselors, and that they have that humility and the empathy to give back to the community that provided them that opportunity to learn and grow and then share the expertise. Just a really empowering takeaway. So that would be the only piece I would share, Don and team, is, that peer recovery piece as well fits really well into this robust process.
Good addition. Absolutely. Does anybody have any questions related to IPS, supported employment, those kinds of things at this point in time? Once again, you can raise your hand. You can, ask to be unmuted, or you can use the chat box, whatever works best for you. And I will say one of the things that we're either going to send out or attach to the handouts, if I can. My colleague Amanda is a technology whiz. I'm always thankful for her because I always learn things from her, but I've yet to learn how to attach a handout when we're in the midst of a webinar. So it may be that I just send it out to you after the fidelity scale, send out to you after the fact. Questions? All right. So seeing none, what I'm going to say is it's time. Oh, here we go. Would love an example of integration with SUD treatment, such as do counselors support this on treatment planning? From Hallie. Yes, absolutely. One of the things that I'm hoping we will be able to make available to you, Hallie, is we did a webinar in months past where Mindy Greenwood from Cascade Behavioral Health talked about how SUD treatment ended up pulling in a supported employment program and all the different factors related to that kind of thing. I'm going to look to see if I can send that to you, because it would be an hour-long presentation related to that kind of thing. One of just kind of the practical examples, like Darren was talking about, was DVR in years past has actually precluded people who had active substance use from being part of the program. And I did training one time with DVR staff, and they said, well, what do you do if a person's actively using? How many people do we know that are our colleagues that are actively using? You know, I had an employer, I had heard the story one time about an employer said, do you think that the only people that are actively using are the ones that you're bringing to us? We have a lot of staff that are actively using. And so it's how do you make it work for the person? As an example, if agencies do drug testing for various different drugs and a person is actively using, we do more of a harm reduction kind of thing. Well, this employer does drug testing. You've decided they're one that's the one you want to work for. And so you've got a decision to make. You will not get hired using the substances that you're using. So do you want to choose another employer, or is it important enough to you to consider whether you're going to quit using that substance? Very much like any of the rest of folks end up doing. I have a very good friend who drank a lot, very honestly, and was incredibly successful in his job up to retirement. We know lots of people like that. I'm not minimizing. I'm saying what we've done in the past with supported employment programs is say you have to be abstinent. No, you don't. You absolutely don't. You do have to determine how you're going to continue moving forward and being successful if you've opted to continue using substances of some sort. But folks don't have to be abstinent. They just don't. So I hope that's a partial answer, Hallie. And then what we're going to do is I'm going to try and see if I can send the link to you to that training with Mindy Greenwood. The other thing is there's a co-occurring conference coming up in October, and Mindy and one of the technical assistant consultants that we work with through a public consulting group are going to be doing a co-presentation on IPS and some of the practical factors there too. So I hope that answers and makes sense. Yeah, Hallie, absolutely. I think I'm awesome. The harm reduction lens is huge. Other questions? And what did you say, Darren? I'm sorry, we were sort of talking at the same time.
No, I just had excellent information about the COD conference coming up in October with Paul and Mindy. So thank you for mentioning that.
Yeah, I'm looking forward to it. Mindy is one, and she's the kind of person, bless her heart, that believes that we all need to succeed and that agencies are not editors with each other. They're needing to provide a good service to folks. So I would hold her up as one who may be willing to answer some questions in the future. I better double check it with her, but I know we've had that question in the past and she was willing then. So she's one that we may be able to connect you with in order to be able to ask some specific questions about how did they do it, because they are successful.
Yeah, I think that's a really good idea, Dawn, because as part of that learning collaborative that we're developing, and Dawn and I go out as well as Amanda and Kimberly, we're doing fidelity reviews where we bring people and team members from different programs to kind of look at agencies and what they're doing. And I had the pleasure of doing a fidelity review this year with Mindy, and we had another employment manager from a different program part of that, and they were able to make that connection to learn from each other. And I think as you enter this new venture, you know, of FCS services, that we're providing services and technical assistance and information so we're not all redeveloping the wheel, that there's people have some lessons learned and some insight or some creative strategies to kind of implement forms into EHR systems. So there is that wealth of information out there that exists, and maybe we could bring people together, kind of share some of that information so that you can have that successful implementation process as well.
Mm-hmm. Absolutely. We get to support each other, which is a nice thing.
Yes.
Other questions? Hearing or seeing none. We're going on another break. And so about 11:05, if you would return, please. Thank you for your attention.
All right, are we ready to get started again and start talking about supportive housing? Amanda?
Absolutely. Yes, ma'am. I'm here. I'm ready. Okay, so hi everybody, this is Amanda Polley, and we're going to talk a little bit about supportive housing. So Kimberly and I especially really love this slide right here with this grand picture that Kimberly found, I don't know, gosh, 3 years ago or so. And it says right there, obviously, we all wish that we could just go to the doctor, get a prescription, turn it in, and dun, 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 dun. One studio apartment, please. Thank you. But we're working there. We're getting that direction pretty soon. But in all honesty, access to safe and affordable housing, and not just any safe and affordable housing, but safe and affordable housing that actually meets housing quality standards. And by those definitions, we mean HUD's housing quality standards. That really is one of the most basic and powerful social determinants of health. Housing is a big deal. Some individuals prefer to begin their employment journey before they begin their housing journey. But we find that without housing, that like was mentioned by Dawn earlier, it really affects mental health. It really affects physical health. Every aspect of your life will be affected when you are experiencing homelessness. And so that's really a big piece of why we do what we do through Foundational Community Support, supportive housing. May I please have the next slide, Darren? Thank you. Just like IPS, supportive housing through SCS utilizes, as mentioned before, an evidence-based practice. That evidence-based permanent supportive housing model is SAMHSA's evidence-based permanent supportive housing model. So DBHR was legislatively mandated to implement evidence-based practices. So when we first started, especially in housing, obviously legislation wasn't going to let us start without being able to say, hey, we have all this proof that this system works. And so that's what we did. And that's why we utilize Fidelity in order to make sure that these systems are being carried out throughout all of these agencies who are willing to allow us in through their doors. So also evidence-based practices are like what Kimberly and I like to call our chocolate cakes. If you want an award-winning chocolate cake to offer to your amazing mother this Mother's Day, or whomever, it is a really grand chance that that's going to happen if you follow that award-winning recipe. And so part of that is making sure that we are giving you the tools and you are utilizing them as well within your agency and your book of practice for these evidence-based practices. So following how those are set up and utilizing those tools is exactly the same as following that award-winning recipe. So moving forward to that continuous quality improvement approach, I did mention Fidelity. I believe that was mentioned before. We incentivize Fidelity reviews. Part of that is also what we call our cross-system collaboration. In Washington State, we are working really diligently at making sure that all of our agencies know that not only can they rely on us, but you can rely on each other. We want to make sure that each of you knows you have a certain set of skills that would be fantastic to share with one another. In my experience, and I could speak for Kimberly too, not that I would, but a lot of our experiences and knowledge came from working hands-on, and we were able to expand that by having what we call job shadowing experiences or doing peer reviews and going across the state and learning how people did our job from a different perspective. And so being able to utilize that is fantastic. Can we move forward, please? Thank you. So when we were talking about that evidence-based model, which is going to be a wonderful thing for your programs, they were all based backwards. We started out in the Porch program, there is the Bridges program, and we began utilizing those evidence-based practices starting out in Pierce and Douglas counties, where the target population was individuals with mental illness or people coming directly out of the hospital. And it was all about that diversion practice to hopefully pull, to hopefully keep people out of the hospitals, to help them avoid stabilization if possible, you know, all through the practice of housing. And the same to be said with the Bridges program. It was located in, or rather, I'm so sorry, I got tongue-tied. Located in 3 sites, Kitsap, Snohomish, and Spokane counties. And it was all about that substance use disorder piece, or that co-occurring is what we call it now. So all of this surrounds that unhoused or unstably housed population that we're hoping to serve. And I think, Kimberly, we are on to you. Unless anybody has any questions, I can sense before we continue forward.
Thanks, Amanda.
No
I
problem.
can't seem to see the question, so if you guys do have a question pop up while I'm starting, just let me know. So as Amanda mentioned, we're going to be talking a little bit about this evidence-based practice. The SAMHSA Permanent Supportive Housing has 7 principles. And this is really our guide for supportive housing. It's really the basis and the foundation of how we provide services in supportive housing. And I want to mention that this is really important to have the consistency and buy-in from leadership from the top down, as this is really important to be a consistent message that everyone kind of understands these principles so that they stay trained and continue to be consistent as we get new hires and people hiring on. It's really important that everyone understands where these principles come from so that they're built into the policies and procedures that we offer our folks, and some of the other pieces like assessments and tools that we use in working with individuals. We want these principles to be weaved throughout that. So the first one is, oh, next slide. Sorry, Darren. Thank you. Darren, can you switch slides, please? All right. So choice of housing is the first and foremost. So it's really oh, I'm sorry, Darren. I think you went too far. That's my fault. Can you go back up to the circles? Thank you. I apologize. I was looking at 2 different screens. So the first one is choice, and choice is really the foundation of all the services, and you're going to hear this one throughout all of the other principles that we talk about. Choice of housing is so important, and we know from data that when people have a choice in where they get to live and who they get to live with, they're going to do better and stay longer in their housing. This is really about asking people what they want and need in housing. That comes from those assessments, spending time getting to know your individuals, and really learning what is needed, because it's not really about what's just a necessity, but also what do you want out of housing? What's going to make you feel good? And really asking those questions about the individual so that we can make sure we're trying to find the best fit possible. And I know that choice is a hard one right now, and we get a lot of pushback on this dimension, because how do you provide choice in a housing climate that doesn't have any choice, right? But there are many ways we talk about this to be able to provide choice to our participants, whether that be through going out and doing additional landlord outreach and engagement to make sure that you're building continual relationships with your landlords in order to provide that additional choice, making sure that you're continuing to have those relationships with landlords and maintaining that just like you would any other relationship to ensure that we continue to have the housing stock that we already do. Because we know that sometimes one bad situation can take a landlord away from us for good. And so we want to make sure that we're really providing support, not only to our participants, but also to our landlords. And but we really want to make sure that our participants have choice in where they're living, who they get to live with. It's really important. The next one is separation of housing and services. This is really about how we're defining the roles of the people that are supporting our folks. So we want to make sure, and this goes for especially with agencies that provide their own housing, that the landlord is the landlord and they provide the role of offering, getting their rent paid to them. They do all of the inspections. The landlord would be the one to provide any notices or give eviction, and that would be their role. And then the service provider, that support specialist, would be the one that really comes and is able to support the individual and doesn't have any housing management type duties. And we're really important for this because what this means is that the person supporting the individual is not holding that housing over their head. That they're the one that's just there to support them and advocate for them. If they start having additional duties that are around that landlord duty, you start changing the dynamics of that support. And people aren't going to necessarily want to tell their landlord that they paid all their money out to buy a new phone as opposed to paying their rent this month. And so we really want to make sure those roles are separated so that we can ensure that we're fully supporting those individuals and they know who to go to. The next one is decent, safe, and affordable housing. This is a three-facet one. Decent is really about that HQS inspection that Amanda spoke about earlier. This is we want folks to know that they're going into units that pass housing quality standards, or if it doesn't pass, that they understand why it doesn't pass and what the importance of that may be. And some people may choose to move into a unit that doesn't pass HQS. And that would be a conversation that we would document and say, we went through this. We have this saying it doesn't pass, and that way we have this form that we can also advocate to the landlord and say, hey, is there any way you can fix this before so-and-so moves in? Or it also allows for the participant to understand that if a unit doesn't pass an HQS inspection, they may not be able to get a voucher to pay for their rent because most vouchers require some kind of inspection prior to paying rent. So we want to make sure we're having those informed discussions with folks about what the HQS inspection is and empower them to know what they look for when they're out looking for a unit for themselves and what's important and what's not for them. Again, it's their choice, right? Whether they choose to move into that unit that does or does not pass HQS. The next piece is safe. So we want to make sure that people are moving into units that feel safe to them. This is not about that, whether there's a railing on the stairs like the HQS, but this is about where they may be going. Does that neighborhood feel safe to them? Is that somewhere where maybe they had previous trauma and it's not safe to them? Or maybe it's an area where they used to use and they don't want to be. They're trying to go through treatment and do well, and now that environment would not be good for them because it may trigger them or expose them to stuff that they're not wanting to be around. So we want to make sure that we have those conversations. Does this feel safe to you? Is this a place that you would want to live? Is there anything, do those pros and cons with folks, because it's really important that they're going somewhere where they feel safe. And then that affordability, that's the key one here. We really want people to be in affordable units. That means we are hoping that they're paying 30% or less of their income towards rent. We really want to try to get people connected to those rental subsidies that are out there, rental assistance, talking to them about supportive employment. Supported employment is so key because we know that sustaining rent long-term is difficult, and a lot of those rental assistance vouchers are only short-term. So getting someone to start talking and thinking about supported employment and what that means for them will help them maintain that rent long-term. And so we really believe that these two programs go hand in hand because you really can't have one without the other. So let's go on to housing integration. Housing integration is so important for an individual. We really want to talk about, there's lots of different types of housing that an individual can go into, whether that be like Oxford housing, recovery housing, or an individual has to stay clean and sober to live, or there's scattered site where individuals are going out into the community and finding units all over, where they're not necessarily living with people they know or living with people that they are connected to through an agency, but it's just an apartment they found. There's, of course, project-based housing where folks are connected to housing through a particular project or housing project. And then, of course, there's, the subsidized and set-aside housing where folks are maybe living with folks who all have mental health diagnoses, or the housing where you have to be connected to mental health services to live there, or part of it is set aside for folks with disability and the other part is just low income. So there's lots of different options and types of housing. We really want people to be out integrated in their community. Not that we don't want to offer full choice of housing. We always want to give them full choice, even if that means that we maybe don't think it's the best thing for them. But if that's what they want and they choose, then we want to honor that choice. We want to talk to them about it, honor that choice, and show them the full choice that's out there for them. If something's not available right now, we talk to them about what we can do to support them until that place is available if they so choose to wait. And so maybe that means that they want to live out in the community in an apartment down the street from where their church is, and that's not open yet. So we talk to them about what other options that there may be. Do they want to go into maybe a transitional house for temporary time, and we help them do that. But really, we want folks to be in that permanent supportive housing that's integrated out in the community eventually, right? Where they can start meeting people maybe they haven't met before, where they can start connecting to those natural support systems. We want to work ourselves out of a job. We want them to find that support system in their community and really become part of their community. If someone chooses to live in a set-aside or a place where services are in the housing unit itself, that's okay. We want to honor that choice as well. Some folks need that. Some folks need services to come to them. And some folks want the support of, people that they know from their agency and maybe take classes with them. So they find comfort in having that network at their housing. However, if we aren't integrating them within their housing, we need to look at how we're integrating them otherwise. Are we helping them get connected to maybe classes outside of their housing or mental health agency? Are we helping them think about volunteering or doing some kind of employment, getting them connected to a book club? So we really want to talk about that integration and helping them build that natural support. Rights of tenancy, we really want to make sure that we're focusing on getting people into units, that they have full legal rights to the unit. A lot of housing tends to come with different rules like no visitors, and people have to sign in, and a lot of times those are ones that are connected to different agencies or projects. And so looking at making sure that folks do have full rights of tenancy when they sign a lease, and if they choose to go into those units, talking to them about, hey, this isn't going to be, you're not going to have full legal rights. They're asking you to sign some things that aren't in a typical lease. Are you okay with signing the fact that you can't have visitors after 10? Are you okay signing something that says that you have to be clean and sober to live here and you can't bring substance on the property? So just having those conversations, and if they say yes and that's what they choose, then we honor that. But making sure that they understand what they are signing, that they know what their rights are as a tenant and also what the landlord's rights are, so they can kind of, decipher when they get that 10-day notice and it's about smoking in their unit, and we can go and say, okay, you signed a lease saying that you wouldn't smoke in the unit. Now, how can we, do some harm reduction to make sure that they don't get evicted, and advocate for the landlord, advocate for the participant there, and talk about how we can meet middle ground. So really being part of that process with them when they sign that lease, if they allow you to help them kind of work through some of those things. Leases sometimes have some really interesting things in them, and they're not always legal, or fit the participants' needs. So we want to make sure that we're looking at that and talking to them about those things. And then the other piece is tenancy contingent upon programs. So do they have to follow rules or they're going to get evicted? We want to try to get them in situations where they're not required to follow rules of a program in order to stay housed. So, there's lots of housing where they're like, if you break the rules, there you go. You stop having services, there you go. You have to go. So we want to ensure that people get to remain housed, whether they're following those program provisions or not. Access to housing is a big one, and I think that you're going to hear a lot about this throughout lots of training. This is very similar to the IPS, zero exclusion, but we want to make sure that people have access to housing. If you've heard the term housing first, our program is 100% housing first. That means there are no readiness requirements to allow someone to come into housing and get housed. We don't want someone to come in and say, I'm looking to be housed, and we say, okay, well, you have to go into transitional for 6 months and prove to us that you can live independently, and then you're going to go see a counselor twice, and then do the hokey pokey, and then come back and talk to me. We really don't want people, we don't want to add those barriers to folks who already are saying, I want and need housing. We want to say, okay, great, let's do it. And we start working with them. And whatever barriers they may have, we work alongside them to kind of work through that as we're looking for housing for them. We want people to be housed. They don't have to prove they're clean and sober. They don't have to prove that they're taking their meds. All of those things are just additional barriers to the folks we're serving who already have so many barriers to getting housed that we want to ensure we're not putting additional ones up. We also want to make sure that they have privacy in where they get to live. So talking, about how, that they have control of their units, that full rights of tenancy again, that people can't just walk in, that our programs aren't just showing up and saying, hey, it's time to meet with me, or hey, I'm going to do an inspection on your unit to see how things are going, but really that they get to choose when they invite us in and when we get to be a part of that with them. So just ensuring that we're honoring that privacy for folks in their unit. And the last dimension is flexible and voluntary services. And this is really about that, being flexible in the kind of services they receive. They get to drive those services and build those treatment plans with you, that we have low caseloads so that we can serve the folks the way that they need to, and that we're not overextending our direct service providers to try to provide for these folks that need a lot of our time. And so we want to ensure that they have lower caseloads so that it can serve folks well and really do that wraparound and holistic care that we hope for. And then just really making sure that, like I said, that flexibility, we want them to have the choice in what kind of services they're getting. We want to be open to allowing folks to have access to services beyond that 8 to 5. So being flexible in how we are serving folks and looking at that with policy and procedure, and then really serving as a team. So it's really important that we're connected with our behavioral health agencies, and that also internally we're working as a team to coordinate care, and then out externally with those other agencies that are providing those other services, whether it be behavioral health, SUD, and other ways, primary care. We want to make sure we're really coordinating care to ensure that we can provide services as a team and that everyone's on the same page. Because we know folks do not like to share their story over and over again, and it really is a big deal for everyone to be on the same page so that we can really assist this person in being in moving forward. Any questions about the principles before we move on? I know that's a lot of information, and I want to make sure that if people do have questions, we honor that, and just know that we will go into more detail with these when we speak with the direct service providers as we go through our training in the next few months. Next slide.
Okay, so I think this one is me, and hi guys, this is Amanda. Speaking of being on the same page, I just want to remind everybody, which is what this slide is for, that community support services, what they are and what they are referring to. We did make sure to keep this slide in there because in the AmeriGroup manual, they do refer to SE, supported employment, and SH, supportive housing, as community support services. So your ability to pop back over here and take a look at this slide whenever you are kind of like CSS, now you can have 100% assurance that this is actually the referral point for CSS. Can I have the next slide, please? There's no need to dilly-dally over that blue slide. All right, so with all of those beautiful principles that Kimberly was just talking about, I'm going to briefly touch up on everything that kind of pertains around all of those principles and the wonderful things that your direct service providers will hopefully be utilizing them for. So that's going to be, obviously housing for supportive housing, and a throw out there towards employment for those of you who are doing both. And then of course, there's going to be that big piece of holding the hope for our participants. That's going to be huge, keeping that positive, upbeat attitude, making sure that we're honest, that we're kind and considerate and respectful. All of that encompasses hope. And in these situations, that can be a really, what is the word I'm looking for? That could be a really sparse feeling to have when you're experiencing homelessness. So that right there is the mecca as far as I'm concerned. Of course, there's med management, can be an individual's needs, life skills, and those life skills can be something as easy as learning how to read. You may be surprised how many individuals actually have a very, very basic ability to read, down to numbers, alphabet, kindergarten to second grade reading level, and will never tell you, and or your direct service staff. So it's really important that we're able to assess for all of that. And again, ADLs, activities of daily living, are incredibly, incredibly important. And so that's all part of this process as well. Housing is broad, it's large. Take for a moment and consider all of the things that encompasses your housing in your personal life, everything you do within your house, every piece of mail you get, every bill you pay, clothing, everything you store in your house, and then that's all of the responsibility that will be handed down to each direct service provider so that they can help an individual who may have never experienced what actual housing is. So those are all of our individuals' needs put in 5 very, very basic, generalized categories. Thank you. And I don't think, Kimberly, I think pre-tenancies is yours. So the next slide, please, and I will hand it back off to you. I apologize again for moving quickly, but we are running out of time, and I want to make sure that we have a chance at the end to answer questions.
Thanks, Amanda. So earlier we had talked about that pre-tenancy support. This is really when we're working with folks to get them housed. And they come in and they say, I want housing, so where do we start? We talked a lot about this, about the conducting assessments. That's really where we're showing that we're offering choice by asking what they need and want, and then being able to kind of find those choices that kind of fit those assessments that those answers that they've given us, and really talking to them about that. Another piece of conducting assessments, though, is really just sitting down with an individual and talking to them and connecting with them. You get a lot more out of those conversations sometimes just with your motivational interviewing, by just having, that kind of get to know you conversation and really start thinking about what their hopes and dreams are in housing. And so that's a really important piece to that. Coordination of care. This is my little soapbox, I would say. I think it's really important that, coordination of care is really key to us being successful in not only housing folks, but helping them maintain housing. Really serving individuals holistically requires that really good coordination of care, and having those partners and partnerships out in our community to be able to do that well is so key to the services we provide in supportive housing and supported employment. Development of community supports. We really want to make sure, like I said earlier, that we're connecting people to those community supports, and also that that we have those resources available to our folks. So I think really understanding that not only are we having to connect them to where they can build their own support systems, but really us knowing the resources in our community is so important. We need to know where we connect people to rental assistance. We need to know where we connect people to energy assistance, where we can get them furniture for their housing, where we can get them clothing to go, to be able to go back to work. All of those things, what benefits and where, right? And those change ever so rapidly in our communities that it is kind of one of those jobs that's not necessarily billable, but we need to go out and do it, right, to ensure that our folks are getting served the best they can. And so maybe it's just one person on a team that makes it their, part of their job to be that resource person, and they're the ones that go out to the housing meetings or the community meetings and gather resources. One of my favorite things to do when we hire new people is to send them out, and of course this is pre-COVID, but send someone out on a resource scavenger hunt and have them go out and collect a few resources out in the community and bring them back and tell us about it, right? And that's kind of a way to not only train them in getting how to build partnerships, but also just going out and learning what's out in the community, because that's a big job. We want to do that treatment planning, so ensuring folks are, establishing those short and long-term goals, allowing them to drive them, like we said earlier, is so important. What do they want to work on? We are here to do intentional services. This is a Medicaid program. So, we want to ensure that we're using the time we're working with someone as intentional as we can. So using those treatment plans to guide how we serve folks. And as they want to change, we change those plans, right? And they don't have to be called treatment plans. They could be housing plans, housing stability plans, whatever you want to call them, as long as we're establishing some short and long-term goals for folks and then really working on how they can reach those and what we can do to support them in those. And if you have questions about how to build those or you want tools and tricks to these, Amanda and I have plenty of different options to provide you to ensure that we are that your treatment plans are amazing and really provide that golden thread of documentation that we so hope you will. That advocacy doesn't stop with the participant. It's also going to be advocating for the landlord at times. And then, we always are advocates. That doesn't change. I don't think we'd be in these jobs if we weren't advocates for the folks we serve. But this is really a big piece of the job, and just ensuring that we have that balance between how we have to work with our landlords, but also that we're really advocating for our participants around what they need in their housing environment. That landlord liaison, I talked a lot about it. I don't want to be too redundant, but it's really important that we're continuing to create new and maintain what landlord relationships we have in our community. This is, we wouldn't have housing if we didn't work with our landlords. They're the ones that kind of are the holder of the key for us, so to speak. And so we really need to make sure that that's an important piece of the job, is that we're going out and working with the landlords and building those new relationships. We're going to be working with them on financial skill building. So talking with folks about, budgeting, how to pay your bills, maybe doing that real time budgeting where you're going out and going grocery shopping with them and working on that, budget they have for what they can spend on food, and helping them also talk about, whatever else. Maybe they want to start eating healthy. And so you can be doing that while you're grocery shopping too, right? It's just really working on those other pieces of how we support folks. And then that benefit support. Getting people connected to benefits is a big thing. I have spent a number of hours over the years with direct service just working through trying to read mail for somebody, helping them kind of decipher what their Social Security mail says. They'll get one letter one day and then a letter the next day that totally contradicts the one before. And they're getting something from DSHS at the same time, and it all becomes really overwhelming for an individual. And so part of our job is to help them kind of work through how to get through all the benefits and navigate those systems. The housing system's complicated, and so really having somebody that can help navigate people through these systems so that they don't get overwhelmed and just stop. Because I know a lot of people do; they just kind of shut down. It's too much. I used to have a participant that would get mail every day, and it just got so much that she just started building a pile on her table, and the only time she'd look at it is when I'd come over for our home visits, and we'd go through that pile of mail because she just couldn't do it on her own. So really being able to work through some of that to help folks navigate that. Some of these are going to be similar coming up, but I'm going to let Amanda go over tenancy sustaining services. Next.
Thank you, Kimberly. Great job. So folks, you'll notice that tenancy sustaining services, a lot of these are going to look a lot alike the pre-tenancy support services that Kimberly just covered. So I went ahead and changed the color of a handful of them that you'll see in there that are just slightly different. So let's talk a little bit about this. We discussed earlier coordination of care and the importance of that. There was a question that came through earlier in the questions box about, could you give us an example of what that would look like? Working with, hand in hand with another agency. I apologize for not knowing the exact question now, and I know that it was partially addressed. However, coordination of care is so ginormous that it really is a big piece of what we do, whether or not we are doing it before somebody is housed in order to help them find that housing, or we're doing something after they're housed in order to help them maintain their housing as well as their mental health, and find a way to feel integrated into their community, because that's really what it's about. When you feel welcome where you are, when you feel like you're a part of things, you want to stay. That's your buy-in, right? Also, another piece of this tenancy sustaining services is your landlord liaison. We want to make sure that we're maintaining those good relationships with our landlords. So they're the holders of the keys, like Kimberly said, but they're also the holders of the eviction. They're also the holders of the 10 days. They're also the holders of, you know, our participants' abilities to remain housed. And so it's our job to maintain those good relationships that we started out with. Treatment planning, that continues. That's also a billable service. Treatment planning, just like Kimberly said, treatment planning, person-centered planning, whatever it's going to be called for your agency, whatever it is currently called for your agency. If you need help in the future, finding a way to mold this around supportive housing or supported employment services, please don't hesitate to reach out to your trainer. East side is Dawn Miller and myself. West side is Darren and Kimberly. You'll have full access, if you don't already, to all of our contact information at the end. So, so let's talk a little bit about those development of independent living skills. Now, I touched on that a little bit earlier, but I kind of want to tell a little bit of a story. I feel like I wasn't always aware of the differences in the beginning of my direct service days of how few living skills some individuals were going to have going into housing. And so I was unaware that I might have to teach individuals how to fold clothes and not just roll them into balls and shove them into their dresser if they were lucky enough to have a dresser at the time. There's also the many grand adventures of Dawn's dish soap in the dishwasher and the panicked phone calls of, oh my gosh, I have a whole front living room and kitchen full of suds. What do I do? So part of this is where we are developing independent living skills with our participants, or your direct service staff will be. And those independent living skills, those are also every little bit billable services that will be able to help your staff with those home visits, going out into the community, skill building, doing things like actively grocery shopping with a participant so that they can learn how to better budget. So all of those wonderful things are also post-tenancy or tenancy sustaining services. And we put a very heavy lean on the sustaining piece because maintenance is huge. It is really difficult to help a participant maintain their housing if you're not knocking on a door once in a while and saying, hey, I'm here, how's it going? Because anybody can meet over the phone and say, oh no, everything here is great. I absolutely didn't get a 10-day. I don't have any problems with my home hygiene. I'm not sleeping until 4 o'clock in the afternoon because my neighbors are really loud. I have no problems. Everything is fine. There are some things, including nonverbals, that need to be witnessed in the home. So as much as that's possible, between disclosures, allowing it to happen with your participants, that home visit is a huge, huge, huge piece of maintenance. And finally, of course, retention. Retention all the way around. If your participant jams out or your staff, your direct service staff say, hey, I don't know, I can't find this person. The consideration of creating a re-engagement policy for participants that become inactive, so that way you have the ability to help with retention, and also a graduation policy to see what that looks like as well. And of course, always and forever, referrals to employment and meeting with vocational support. Okay.
Hey, Amanda, you have a question in the chat box from Hallie.
Okay, can you read it for me? I can't access it for some reason.
Okay, it says, where can I find a list of which case management pieces are considered billable services?
That is a great question. So we have a whole list of tenancy sustaining services that we can send to you. But really what it boils down to is training. Like, I would really suggest reaching out and just asking, can I bill for this? Can I bill for that? What does this look like? We do a really great job of letting you know, hey, if you go for a drive with your participant and you're talking about housing and you're looking for stuff and you're discussing what that looks like, or you're working on your treatment plan goals, you can bill for it. Housing is, like I said, housing is a little bit of a different animal than employment. It's got a little bit broader of a scope, a wider brush, so to speak. And so your ability to bill for things is a little different. Of course, it absolutely has to be medical necessity. So why you always have to remember this lens for your direct service staff. Why can't this participant do this without your direct service staff? What is it about this that what is it about this event or this task that they need Susie Q, the housing specialist, for? And then
yes, is it housing related?
Is it housing related? Exactly. We always tell people, stay in your lane. It's so important to stay in your lane, because once you start moving outside of that, then things start getting a little murky. And then you wonder, can I bill for that? And so, not to say that creativity isn't important, but we want to be careful, right? Because Medicaid's Medicaid, and we want to make sure that we're staying in our boundaries. There's also additional training that's available for that. So if I have an entire training that is literally deliverable services or services, billable services. And so I can give my slides to Kimberly if you're on her side, and she can do a presentation for you, or we can figure out whatever needs to be done. But we offer trainings, targeted trainings constantly. So you will never be left in the dark if you just reach out and let us know what you need from us. I hope that was helpful.
These services are also listed in the AmeriGroup Provider Manual, so it's not going to give you, unfortunately, like Amanda said, it's got housing's a wide scope. When we say it's kind of got a lot of gray areas, so you just, as she said, stay intentional. Is it housing related? Is there somebody else in their support system, whether it be a peer or case manager, that can do this for them that's not, since it's not related to housing? And if not, do we need to connect them to somebody like that can help them do those things that aren't housing or, for employment related, so that we can ensure we get that wraparound? Again, these services are really about ensuring that folks have somebody that's solely focused on their housing, solely focused on their employment, and then utilizing those other, support systems, case managers, to ensure that they get those other pieces of their support met as well. That way we can all stay intentional, and there isn't something getting put to the back burner because we're focusing on whatever crisis is happening in their housing or whatever is happening in their employment. And so everyone kind of focuses on that. That way they have that holistic team.
So Hallie did say thank you, and she would like training on that. Hallie is with Compassionate Addiction Treatment in Spokane, Amanda, so that would be you.
Awesome, Hallie. I'll get a hold of you, and we will definitely get that training going. Okay, I'm so glad.
Can I mention one other thing as we're talking about housing and about these sustaining services? I just want to reiterate that a lot of times people think that finding the housing is the hard part of working with individuals, but really, when you're working with a population of chronic homeless individuals, a lot of times it's not the finding of the housing that's the hard part, it's the maintaining the housing. It's about understanding, like Amanda said, sometimes you don't realize what kind of needs they really have until they get into that housing. And you think the person that you thought would do so well in housing is the person that's struggling the most sometimes, because they don't necessarily have the ADLs or the independent living skills that maybe we thought, or maybe they just didn't, kind of talk about that. So sometimes it's that maintaining housing that's really hard, because they've never lived in a place themselves. They've never had to pay bills. They've never learned how to cook on a stove. They've never used a washer or dryer. And so these are all things that, sometimes we, as, take for granted that we know how to do these things, and that there are people out there that maybe never were taught these skills. And so it's sometimes then that we have to really start talking about those boundaries. You know, don't move in your other friends that don't have a place to live, because that's going to risk your housing. And there's so many things that kind of go into that. So sometimes it's really the maintenance that really, you know, gets us having to work hard for those folks and help them really stay and supported.
So I do see another couple of comments. One is Allison from Castile Williams said they would like to take advantage of the training on billable services as well. And Hallie had said getting housing after a long time unhoused can actually feel like a trauma. I would believe that to be the truth.
100% true. In fact, I talk to people all the time about how sometimes it takes an individual a really long time to, even though they say they want housing, to really commit to that. And so sometimes they'll go through 5 choices and not pick any of them. And you kind of have to go back and go, okay, is there something going on? A lot of times when it becomes real to them, they start, you know, stepping away from it. It's kind of, some people get afraid. And then sometimes it's just about, once they are housed, getting them comfortable, like hanging things on their wall because they're afraid the other shoe's going to drop and they're just going to get evicted, or, you know, not wanting to unpack their boxes or sleep on a bed because they're not used to sleeping on a bed. And so there is a lot of trauma around that as well. It's very accurate that we deal with a lot of that as people are getting housed. Okay, next slide.
Thank you for that overview of housing, Amanda and Kimberly, and managing those great questions. Dawn, this kind of feels like the 7th inning stretch in terms of our presentation today, as we try to get all the information out to you to make really educated decisions about implementing these evidence-based practices and being leaders in your different roles at the different agencies to make sure that everybody has usable tools and the platform which to offer all these services.
Absolutely.
So this is Darren again, and we're moving on to some of the executive leadership responsibilities in developing and implementing evidence-based practices. Definitely for the IPS model, there's a lot of focus on the leadership and the management and the CEO that you, as the director or the executive director, have some familiarity with these different principles. Not that you have a broad, in-depth knowledge about each individual item. As we talked about supportive housing and supportive employment, there's a lot, and this is just the surface for the principles, but to be aware and to embrace these, to implement at the different agencies and the principles. An important part of many agencies for many funding sources, particularly Medicaid, or if you get funding from different counties, is the quality assurance process that you might have at your agency. And Dawn and I work with agencies to try to implement our IPS models into the QA piece. Not that all 25 elements are being looked at, but that some of these elements are being incorporated into this quality assurance process, and it really allows the program to be looked at a very high administrative leadership view, and it also has that opportunity to educate more executive leadership about some of these key and fundamental elements of evidence-based practices. I think when I was running a supportive employment program in King County, I think this transition, working and to advocate to get it to this QA level, it was very hard and a lot of work, but it was also very complementary in terms of having leadership from different programs learn about this, and I think understand a little bit more about the why we're doing certain things and to provide education. So I think it's a great way, it's a great tool to educate executive leadership, but to also have those discussions about challenges, barriers, and successes of the program as well. One of the principles that IPS focuses on is the development of a steering committee, built up of stakeholders, members of the agency, at least one member of the executive team, hopefully people with lived experience, stakeholders, all those different components to kind of look at how having that another high-level view for employment or even supportive housing about how things are being implemented, how people move through your programs and the support that they have. And also always having, you know, part of that braided piece of the evidence-based practice principles as part of that. So there's always that supportive housing piece, or always that supportive employment piece that is part of that committee. You know, metrics and data is really running a lot of programs and funding streams, and I think this is also a key area to develop and have those kind of quarterly reports to know where programs stand in terms of bringing people in, working with folks, getting out in the community, whether it's for supportive housing or supported employment, that people have some autonomy to develop those things in the community. And definitely during the pandemic, I think King County is just rolling back into a phase 2 for next week. So we all have these real life challenges and barriers that we're working around, but it's part of that philosophy and part of that foundational piece of how we operate our programs and share that data. I just had the pleasure of being on agency in Spokane where they were working on a dashboard and have some of these metrics available real time to provide that kind of updated information, which could be very valuable in terms of providing revenue and looking at productivity measures as well for staff as part of that. Communication is really important. And as the executive team, when I was part of an agency and in terms of my current role at the HCA, we really look up to executive directors or directors to provide some information and some leadership and guidance and some updates about how things are progressing, how different programs might be rolling out, are goals being achieved, are we being successful in those elements that we say that we're doing. And these models both have many, many elements that they work on. You don't have to go through all of those, but to definitely key in on those specific elements to focus on across the agency at a regular basis. Some agencies I've been able to do reviews, they actually have that piece where it starts on the onboarding process. That the leadership team, the HR team talks about that. Another important piece could be the development team, so that they also have some data collecting some of those success stories of people being housed permanently or people getting permanent employment that they can also use with municipalities, with the county to go after certain grants and funding. So the mission and the drive and the elements that these programs produce can also be incorporated and braided into those different proposals. Barriers do exist, and they do come up implementing evidence-based practices. And we want to make sure there's that opportunity for a manager or a supervisor to work with their leadership, to work with their directors or other managers, to talk about some of those things, that they're not just siloed somewhere, but there's that opportunity to talk either with the CEO as part of the IPS model has, but the executive team, or maybe even a board of directors, that the staff can go and share some of those challenges that they face implementing these different elements of best practices, but also some of those success. So people get that full experience of people coming in, but that the program is connecting and building those relationships with people coming through the FCS door and having some of those success. Part of the success could be just as was mentioned with housing, is learning what some of the barriers are and how they can adapt. The same thing goes with employment in terms of the ownership and the desires that people have, and some of that self-reflection during the journey. So definitely we're very focused on employment, competitive employment on the employment side, but also that kind of self-discovery process as well. Thank you.
Okay, thanks, Darren. That was great. So this one is mine. This is Amanda, and we're going to talk a little bit, just a little bit, about best practices for hiring direct service staff. So I'm sure that each of you have a pretty good idea, if you haven't already hired, what you're looking for in who you want to hire for this job, for your direct service staff, for either supported employment or supportive housing. So each of you have a team, I'm sure already, whether or not that's specifically a CSS team, a community support services team, or it's just your small community team right there. And you're going to want to look for somebody who's going to fit in, obviously. But before you do that, if you haven't already, or you're still in the midst of it, we have a few, we have a few suggestions, right? So part of that is going to be making sure that you define that job really, really, really clearly. We find that in the past, especially, all of these jobs are very heavy. They take a lot of hard work. They take a lot of emotional taxing. And so it is going to require being very thorough in your definition of what your expectations are going to be for this full-time or part-time position that you're hiring for. And plan your recruiting strategy. So remember, we spoke a little bit, Darren, especially on peers. Peers are fantastic in these positions. Peers hold the hope for participants. Peers, without saying a word, aside from I'm a peer, are a fantastic option for offering to your participants and showing them not only is there hope, but you could do this too. So that's a really great way of kind of upping attendance to appointments, also as a way of really getting through and making a difference. So even if you don't hire peers, even if that's not going to be part of your book of business, making sure that your recruiting strategy includes diversity is going to be big. Let's see here. Well, you could just pull all of your interview questions straight from HR if you have one. Grab some off of the internet, some basic gen questions, and that might work for you. And it does oftentimes, but I can't promise you longevity. Nobody can in that situation. So in the off chance that you may need some additional help, or you have some questions about what might be a good question to ask, please make sure that you reach out to us. Each of us have direct service experience in our field, and we're all subject matter experts. And we would be so happy to help you find or set up this search or these details in order to find a direct service staff that will help fit your needs as much as possible. We have policies and procedures that we can offer as examples. We have job descriptions as well, and that's equally helpful. Let's see here. That's fantastic as well. I didn't see that part. My apologies. Using scenarios and questions geared towards determining applicants, that's a huge piece. So saying things like, so if you had a giant conflict in the office or with a participant, what would that look like? How would you? What is your harm reduction skills like? And finding out, what is this? How does this person handle conflict? Because in this position, whether it's supported employment or housing, there's going to be conflict. It's just the nature of it. We hope to avoid it at all costs, but there are times when conflict creates advocacy, and advocacy creates empowerment. And so conflict, hopefully lower end conflict, is not always a negative thing. It can actually create a positive situation for a participant in the long run and for your staff. And then, of course, onboarding. Using the fidelity skill as a training tool, whether that's IPS or it's SAMHSA's evidence-based practice for housing is going to be really important. And we will provide you with everything you could possibly need in order to help pad that way. If you don't choose to do that, that's perfectly acceptable as well. But please know that I know we keep putting a heavy, heavy lean on this fidelity piece, but there's going to be a heavy, heavy lean on fidelity. And it's really great just to get started right out of the chute if you have the opportunity. And again, reach out to us. Each one of us have a plethora of fantastic resources for you, whether they are printouts, resources from Washington State altogether, stuff that's individually for your region, your area, and not including, we have fantastic partnerships as well, all throughout Washington State. So aside from that, you know better than anybody else what your best hiring practices are and maybe what they haven't been in the past. So hopefully you can mold that around there.
Hey, Amanda, could I add something just briefly? This one is meaningful to me. I mentioned I was worked in a supported employment program, and I was a supervisor for that period of time that I was with the behavioral health agency. There were a couple of times over the years that we hired employment specialists that were not comfortable going out and talking to employers on the behalf of people in their caseload. And went through counseling, went through training, went through mentoring, went through everything we could think of, but bottom line was they weren't a good fit for the job. And so I say that, I say that, and I think I was the one that put in the use scenarios and questions, find out if they're comfortable getting out in the community, because you don't want somebody for their benefit or the agency's benefit to be a bad fit. And that's such a huge piece of what we do. If they are not comfortable going out and advocating on people's behalf, and I supervise 2 of them, you hope to avoid hiring those people. And those scenario questions really can be huge when it comes to that. Thank you for humoring me, Amanda.
Of course. And I'm done, actually, so I think it's Kimberly's turn.
Yeah, and that's a great point, Dawn. Thank you for making that, because that is a really key piece that not everyone is comfortable doing. I know that when I first started, that was what I was most afraid of, was having to go out and do that piece. You wouldn't know that now knowing me, but that's the truth, is that you want to make sure that you've got people that can really do that piece of the work, because that's so much what we do, right, is advocate for our folks, and we have to be able to do that even in difficult situations. And sometimes when there's conflict with an employer or a landlord, that can be a sticky situation for us to be in. And so we have to be able to navigate through that well. All right. So now we're going to talk about supervisory considerations, and we at DBHR focus a lot on supervision throughout our trainings and our programs. And the reason for that is we really know how supervision sets a tone for a program, and it's really key to retention for folks. And, I know that sometimes people are more likely to stick into a position when they have a great team and are less motivated by the money, right? If they have a good supervisor and they feel supported and they like doing their work, because when they go, they know they're going to have that good supervision. That can change whether someone's getting paid as much as they want, right? Because they know that they're in a job that they like and feel supported in. And so we make a big focus on supervision and the considerations for this program. And so, we talk a lot about teaching and practicing that zero exclusion and teaching about implicit bias, not going out and taking our own biases out into working with folks, but making sure we leave those at the door. That it's not what's best for us or what we think is best, but it's really about those participants when we're working with them, and really talking about making sure that everyone has full exclusion access to our programs and what we do, and that we're, like we said, we're just leaving those biases at the door. Really talking about the exercise of mindful inclusion of duties. So making sure that there's time for supervision is so key. I know we get so busy and sometimes so spread thin that supervisions sort of happen. I used to make a joke with one of my supervisors about getting drive-by supervision, because there was never really that intentional time to sit down and talk with me one-on-one. And so we really want to make sure that we are spending the time to not only to supervise people on what's going on and what's great, what they're doing great and what they might have opportunity in, but really asking what they want to learn, because we as supervisors can be mentors. A lot of times we've done the job and know it, and so they're looking up to us to kind of figure out what and how to do things well and those best practices, and really looking to so we end up being a mentor to folks in a lot of ways. And so making sure that we're leaving time to talk to people, doing that one-on-one, and not only team supervision, but to really have some time for them to just ask those kinds of questions and grow in their job. We want people to grow in their work. So that integration and collaboration, we as a supervisor for a program like this sometimes really have to work hard to become part of the bigger picture, and not end up siloed as a program. And so making sure that we practice and show collaboration within our agency and externally in our community, and making sure that that's what we show our team to be and to do, is to really be that collaborator, to that coordination of care, whether it be internally or externally, to make sure that people are getting wraparound services and that we're all connected and feeling supported in the work that we do. Because we talk about how hard this work can be, right? And it is. It's not easy work that we're doing. And so people need to have a place where they can feel like they are supported and have a place to vent when they need to, so that they can work through what's happening and be able to go back out and support our folks the best they can. And if they're not supported, they're not going to be able to do that out in their work. It kind of leaks out onto our participants, some of that, some of those feelings, and sometimes just that burnout that we get, right? As a supervisor, we really talk about tracking data. I used to like Excel, and I hate Excel, but let's talk about how important tracking data is. It's so good. I know when you're going to be working with us, we're going to ask you to have a data sheet that you kind of track things, and I think IPS has some things as well. And so really making sure that we're looking at that and having that, not only for the purpose of, oh, I have a report to write and I need this, but it allows your team to kind of see where you're at all times, right? And as you guys track that, you can kind of monitor what's working, what's not. And then, as you start to track things, you may find that you have other things you want to track, and then you want to add another thing you want to track. But it's really great because it's all kind of those one-stop shops where you get all that information. You're collecting the data for the demographic that you're serving and really helping build this program by doing that. You want to set and monitor goals for the team. So not only is that like on an individual basis with the person, one of your employees, we want to have those individual goals with them and talk about that. But as a team, where do we want to go? What is the big picture, and how are we going to get there? And really talking about that throughout our work to remind us and keep us intentional. Sometimes we get so like I said, stretched thin, I want to say, and we're out doing the stuff. And sometimes we need to come back together and say, hey, we set this goal and we're rocking it, or we're beating that. We wanted to house and employ 10 people, and oh my gosh, we're at 15 this month, or whatever it may be, to celebrate the successes of what each other are doing and the team as a whole. It's really important to do that because that gives us that empowerment, encouragement to keep moving forward on those hard days, right? Facilitate and document team meetings and supervisions. Really, that's one of those things that's a good idea to be, just kind of taking note, having an agenda for a meeting, taking notes throughout them. But it's also a piece of fidelity that we'll ask, do you have team meetings? Can you share some team meeting notes so we can see how that happens, what that looks like? And it's really important that as a team, you guys do have those on a regular basis in order to collaborate and really staff people and talk about some of the challenges that you may be going through individually or as a program in working with folks. You want to make sure you're soliciting and publishing success stories. I cannot say this enough. We at DBHR are very much interested in having success stories sent to us. We want you guys to celebrate the successes and then, make sure that you're talking about them. That's not only going to benefit your agency, but man, we use success stories all the time to talk about our program and what it can do for people. And these success stories are actually becoming part of the data we show when we are talking about FCS long term, right? We want these success stories. It's great to have people see how people have become housed and employed and what that looks like, not only from an agency perspective, but also from the participants' perspective. It's so important. that mentorship that comes next, I mean, that is something that's so big. You know, it's really hard to supervise a program and a job that you aren't familiar with or you don't know. So one of the things that we encourage is that there is some shadowing experience, that supervisors are going out with their employees and seeing how they're doing the work, learning from them, and them learning from you about the kind of work you're doing. It's really important to do that. It not only is an accountability piece, but it also just makes sure that, you know, you're out there helping support them on the ground or out on the ground, you know, that you're out there doing that work that's not necessarily just behind a desk. They don't have to just come to you in supervision, but that you're out there actually showing that you understand what their day-to-day looks like, and that it's important that you have that kind of relationship with your folks in working in this work, because it's hard when you want to go to somebody and say, I'm having such a hard time, but I don't know that they know what I'm doing, right? I don't know that they really understand my job. So being able to be, you know, I go out there with them, I understand what they're going through. You know, most of us come from some direct service perspective, but not everyone does. And so doing that kind of mentorship and just job shadowing to support each other is really key. And then we talk about low caseloads for our folks, but as a supervisor, sometimes supervisors end up carrying caseloads too. And we want to make sure that we look at that, because a lot of times, you know, I think of like, you know, my caseload is the agencies I work with. And so part of the supervisor's caseload is really those employees that they supervise, right? And so having too many duties on a supervisor really spreads them thin and doesn't allow for them to support folks the way they need to and do those other jobs. So we talk about low caseloads for our folks that are serving our individuals, because they really need that time to support their participants, to do those other duties as assigned that we all have, right? So it's not just about direct service face-to-face time, but a lot of times we have other duties that are part of our job. We have documentation around supporting these folks. We're required to maybe do so much landlord outreach and engagement every week. And so we really do have to ensure that we spend time as supervisors thinking that same way, that we want to make sure that if we have all these other duties, that we're making sure we have time to do that supervision and take that time one-on-one and as a team to meet with them and make sure that people are feeling supported in this work. Does anyone have any questions? All right, next slide.
All right, so this is Dawn again. I'm going to talk a little bit about supervisory tools. Some of the stuff, I know you've got a lot of what is contained in the slides that we put together are based on questions we've asked over a period of time. Hallie, I'm going to go back to your question. It says, what do you consider a healthy caseload for supportive housing and employment? For supportive employment for highest fidelity, they recommend 20 or fewer people on the caseload. And from a supported employment standpoint, part of that is to be able to provide that long-term follow-along. You know, I mentioned job coaching and the potential for some people to need that. I did job coaching with people in my caseload, and in some cases, for the folks with the greatest needs, it meant being there for the number of hours that they were scheduled for a shift, 4 hours, 5 hours, however many hours, and on whatever shift. So some flexibility is key. I actually did some job coaching on graveyard shift a couple of times over the years, thankfully only a couple of times. But if you have too large a caseload, you're not going to be able to do that. You're not going to be able to devote you know, multiple hours per day for, you know, multiple days in a row if your caseload is too huge. So from a supported employment standpoint, that's what it is. Supportive housing, Amanda and Kimberly, it's also 20, 15 to 20, I should say.
It's actually for high fidelity. Oh, go ahead.
No, go ahead, Kimberly. It's fine.
For high fidelity, it's 12 to 15, and we wouldn't want the caseload to go over 20. You know, we really want, like, again, the same thing as we really want to be able to have that time to support individuals. So we wouldn't want someone going over 20 people. 12 to 15 is really ideal to ensure that folks have time. You know, we don't know if we're going to spend an hour with someone or 3 hours with someone some days. And so we want to make sure we can support them and our other folks as well.
And that's the bottom line related to that one, is the caseloads are a size that have been determined through research to be viable to be able to continue to provide services to everyone on the caseload, even when you have somebody that has intense needs at the moment. Good question though, Hallie. You've asked a number of good questions. Appreciate it. Appreciate the input. So, you know, I know that these slides about hiring and supervision tools, some of you have got it down and always have had. Some of you may still have questions, and so we're speaking to that group that potentially has questions, because I know that in each of these slides we've included information that are questions that have come up over time. I see another one from Hallie. Working with our unhoused, we can have a number of people who go inactive for a while. Is it okay to adjust the number related to this? Once again, I'm going to speak to supported employment. When we come and ask you about your caseload, we ask about active and inactive, even though it's not really an IPS thing. But we've got a MERA group in the mix. And if you haven't heard, what you will hear is that if a person goes inactive, a MERA group doesn't really want you to close them within their authorization period. So let's say they go inactive 1 month into their 6 months. A MERA group would prefer you to just keep them open because that's their preference. We've adapted a little bit in regards to when we do fidelity reviews, we ask about who's your active caseload. In other words, who are those people that you're actively working with and not kind of on that list of a MERA group folks that are still within their authorization period but not showing up. So I hope that makes sense. So supervisor tools and consideration. You know, you see midway down the slide, if it wasn't documented, it didn't happen. I hear that in my sleep sometimes. And I think we all do if we've been providing services for any amount of time. We know that that's the case. Well and good to be able to state the principles and say we do this or that, but unless you have documentation, you know, it isn't necessarily going to be taken at face value. Although I will say, as a lead fidelity reviewer, there are times if enough people say it, I take it at face value. That might be a failing on my part, but I don't consider it as such. So tracking tools will maximize your supervisor's time. Kimberly and Amanda mentioned it. Darren and I have mentioned it. It isn't just for when a fidelity review is done, but I have to say it sure helps. I do know, having been a supervisor, if I have a job development log, that I can go through and count those 6 per week contacts by an employment specialist. That's maximized my time. I'm sure if there's a housing or landlord log and the supervisor can look at it briefly and see where a person's been doing outreach to landlords and can do it kind of in one place as opposed to having to comb through progress notes, it maximizes time. Within supported employment, some of the fidelity principles ask things like, well, the rapid job development that I was mentioning. So you've got to have a track of what was the first contact with employment staff, a date, and then what was the first contact with an employer out in the community. It's lovely if that can be on a participant log. Lovely for you, lovely for the supervisor, lovely for the employment specialist, too, to have that participant log in relationship to the supported employment. The sample log that we've got was actually developed for the BEST program by Melody Pazolt, and it has kind of a column by column the things that you need to track within fidelity. So it's a one-stop for seeing a lot of the documentation that had to occur, and it just makes supervising and monitoring so much easier. The participant log that I'm referring to actually lives on the Pathways to Employment website. There are, and I've mentioned it a couple, 3 times now, it has just a wealth of things on there, some of the forms being one of them. It also has things like there are 4 2-hour webinars on benefits planning. So each of the 4 addresses a different topic. But if staff was to watch those webinars for free at their own time, they would have a basic understanding of benefits and what goes on with that. So obviously it would be good for housing staff as well as supported employment staff. That website has information about helping people with justice involvement to become employed, and with veterans, and with various other folks. So I highly encourage you to take a look at it. The participant log being only one of the things that you might find there that would be helpful to you. Within supported employment, there is also the IPSworks.org, and it'll be on a resource list website that has a library that has tools like how to start up a program. Some of the considerations there. Has tools like the Fidelity Scale and the Fidelity Reviewer Manual and white papers about how to do job development in rural areas, and just a huge variety of things. So that's also a resource to bookmark, to put in your favorites, because you'll find a lot of information there that's helpful. Various of our team members today during the webinar have talked about pulling data to use for newsletters and things along that line and sharing with the team. It gives the team hope to hear the success stories. But I have to say, as we're working towards sustainment of foundational community supports, part of what's going to get the legislature to continue to be interested in fund are those success stories. They have heartstrings that are pulled too. And so I can't stress strongly enough that having those success stories available helps staff to keep going. We're all in it not for just the money. We're in it for the good things that we do with individuals, but it helps staff to keep going. It also helps various different funders, people that might grant us money in various scenarios, to see the real life work that we're doing, which solidifies the importance. One of the things within supported employment and fidelity review that is within one of the principles is, we talk a lot about the fact you're not going to develop jobs if you're not talking to employers. And once we're outside of the COVID restrictions, you're not really going to be successful with that unless you go face to face. I know that I got an email yesterday about a fidelity review that's coming up, and they said, can we do it face to face? And I said, no, sadly not, because I'm dying to see some real live people. Think about that in relationship to reaching out to landlords, reaching out to employers. How important is that face-to-face contact? I started really realizing just more and more how incredibly important it is. The principle has kind of been, brought forth to me that the importance of doing the face-to-face things is huge. And so one of the tools that we ask for if you're doing supported employment, and I don't know, Amanda and Kimberly, if it would be important too for supportive housing, is a tracking system that shows where staff are, location and duration in the day, shows whether they're out in the community and doing things. So incredibly important. This is another one of those things that if you need some support, let us know. We can send you links where to find the documents. We can send you sample documents. We can connect you with, within that learning collaborative, other agencies that are doing it that have great information. One of the things that I find when I do fidelity reviews, and I also hear from fidelity review team members, is that they really appreciate seeing the wonderful things that other agencies have come up with. I'm not shy about telling agencies I would love to steal this to share with others because you've done such a good job on creating whatever the tracking tool is or whatever the document is. That's one of the benefits that you get from that learning collaborative, is getting the opportunity to see those things and not have to recreate the wheel. Next slide, please, Darren. And actually maybe one after that. So one more. There we go. I think I'm turning it over to you, Amanda.
All right, thanks. So, what's next? Assessments. So I I feel like this slide's a little out of place, and that's okay. We did touch a little bit on assessments and the importance of them, and I want to make sure that we reiterate that again. Dawn did talk a little bit about supervision tools and considerations, and so when she mentioned that we have a ton of like tracking tools, assessment tools, all kinds of resources for you through DBHR, and that's going to include things like forms, assessments. Kimberly was fantastic at finding this condensed version of an HQS report, which is a housing quality standard report that really helps participants in housing feel very empowered. When it's more than just a standard walkthrough. Are there nicks? Is the cupboard doors on? You know, it's just has a little bit more oomph to it. So that's a really great form as well. And so we have a lot of that to offer you. But the biggest piece that we found about assessments is it's not just good for us at state level, and not just good for you at an executive and leadership level, and not just great for your for all of the data that we keep talking about that's so important, but those assessments are going to allow for time. And time in these situations between your direct service staff and your participants is the most valuable thing there possibly can be. Because in that time, assessments are going to allow for multiple things to happen, whether that happens during the first hour, that first assessment, or 3 visits later. What's going to happen is those assessments are telling your participants, you value my opinion. You believe that these are the things that I need because I'm telling you this. It's empowering. It opens up lines of communication. It builds a trusting relationship, not just between your direct service staff, but also between your agency and that participant, which is huge, because we all know as as leadership that word of mouth is giant in this world, especially among individuals who have a tight network. And the majority of the time, if people are living on the street, their network is tight on the street. So if they say, hey, I was hanging out at XYZ and their staff are super nice and they listen to me and I don't feel like they talk down to me, and I felt really good when I left Susie Q. You should go check them out. I'll go with you tomorrow. That's a big piece of what we do through Foundational Community Supports, is that trust building. And so all of this stuff, it does take time. For some individuals, they're going to open their mouths and they are never going to stop talking. And that is great. We love all that good, resourceful information. But sometimes it's going to take a minute. Sometimes, as you all know, not everybody's going to be incredibly forthright. There's going to be the occasion where they don't want to give out their phone number, and that's going to make things hard. Or they don't want you to know anything about them except for one initial and something else. And your staff is going to say, hey, I'm having a really hard time with this. That's okay. We're just going to keep plugging away. And when that seems impossible, or you're not really sure how to advise your staff, that's when you're just going to send us an email and reach out to us as your trainers and say, how the heck am I supposed to help my staff mitigate this? And that's when we're going to blow the horn and come trailing on in with all of our fantastic training. But it's certainly not easy. It certainly takes time. And it is an absolutely worthy effort, I promise. Next slide, please. Darren, tag, you're it.
Thanks, Amanda. And thank you to everybody for absorbing all this information that we presented today, that we hope this creates that dialogue to ask questions and get some more assistance and learn how to implement, because we've provided a lot of information today. As Don had mentioned, and we all talked about all the training that we provide as trainers, and we contract with consultants and technical assistance folks to provide additional training as like Don mentioned, the job developers training, supervisory support training. I know Rutgers has put together, the Golden Thread documentation series, which I highly recommend to everybody to take that, because that really helps with that medical necessity and focus on documentation for services and treatment planning. Plus, there's the reviews for fidelity that supportive housing has and that supportive employment has. And that's a great way to even learn more about all these principles without actually having to go through a fidelity process, but it gives you that in-depth, hands-on piece to learn more about the models and how to use some of the elements, and then to be able to make informed decisions for the different elements that we've talked today, and how your program is going to be able to adhere to those to build the program and be successful providing the services to the Medicaid participants. There's also an FCS newsletter that we encourage people to register so that you can know about some of these trainings coming up. We can also add emails to our GovDelivery list so that you are aware of different trainings and information that we generate here with the Healthcare Authority. Reach out, call us, email us. We're open for consultation for any kind of questions that come up for housing and for employment. It's a great way to get some information, but kind of build that repertoire of services so that we're both learning from each other and implement new things. Even though I'm a lead fidelity reviewer, I always ask for feedback on how I'm doing, and if the information I'm providing and the way I'm delivering the materials is very helpful, I want to be able to know and make adjustments. So just like the training today, that we're providing information that's useful for the audience so that you can take away the information and actually implement there at the agency. There's also event calendars to find out what is coming up for all the training opportunities that we're providing here at DBHR and the Healthcare Authority. And soon coming up is that the trainers have been working on upcoming incentives for additional fidelity-focused events. So we looking at a baseline review to come out and really learn what's going on virtually right now in terms of the program and how different programs are adhering to the different elements of fidelity, and that we also do follow-up reviews to see what's changed since we first came out and took a look at the program. Have things changed? And we also look for review team members. It's another great way to come on board, to go through one of the fidelity trainings and then be part of that review piece, to put everything in action, to find out how interviews are done, how we look at different information that agencies provide, how to work with a team of reviewers to look and assess and then provide scoring, and then the efforts that go into actually writing a fidelity report. They're both very technical processes, but the takeaway is that people are very grateful for being part of this team and part of this learning experience. And I've really found out that now that I've done over a dozen fidelity reviews, that the first couple you learn a lot, and then you learn how to apply principles in different ways. And still, from doing this process for over a year, I'm still going back to that fidelity manual to see how things apply. It's kind of that, the roadmap to success. And even with more experience, I still find myself going back to see what is that original intent. So definitely these are some of the opportunities that exist now, and we hope definitely that the providers here today and the staff will be part of the trainings and part of our future incentives for the fidelity review processes coming up in the next year. So thank you for your time, and thank you for staying with us today to get through all this information.
All right, so this last slide is really just resources for all of you who have stuck through it today with us. These are some things you can go check out. You will get the slide deck when we're done here, so no worries about feeling like you have to click through all of this or write this all down. We will make sure you have all of these links. Just want to go through some of them briefly and talk about them. The SAMHSA Evidence-Based Practice Toolkit is all you'd want to know about permanent supportive housing, the evidence-based practice. It's what we use in our fidelity model. It's going to have the score sheet and the dimensions broken down for you, kind of how to build your program around fidelity. So please check that out. Some of this material may have already been sent to you or been attached to this webinar, but this is the website where you can find all of it right there. We have Pathways to Housing and Pathways to Employment that we've talked about a little bit today. Both of those are amazing resource sites that we've built at the state that provide resources for you as an agency, for employers and landlords, as well as the participants. So there's all sorts of resources, and we're constantly building and adding to this to make them the current and amazing resources for you guys. There's even continuing education training modules for peers. There's an employment application. There's a housing application where people can put their information in and keep it. So we really want to make sure you guys check out those two websites. They're really cool. We're constantly making them even better. So stay tuned, but they have a lot of resources for everything you could think of about housing and employment. And if you find something that there's a gap in there that you guys aren't finding, ask us and we will try to add it if it's not there already. There's some information on Community Action Council and HUD. You know, the CAP agencies are a huge resource for folks and that we're serving. They're a great partner in the work that we do, whether it be rental assistance or energy assistance or legal aid. There's so many things under the CAP umbrella that we want you guys to ensure you have really good relationships with your CAP agencies. There's HUD, Washington State Housing and Employment wikis. We have the wikis up. Those are kind of a shared database that we've been using for a very long time at the state, where people can post things, all things supportive housing and employment. There's old webinars there and just information that you can access, and anybody can get access to those and share information between each other. There's the PSH toolkit. Again, building your program, that's part of the evidence-based practice I talked about earlier, but that's just a specific link for building your program. It's got some great information for the executive leadership and supervisors in getting that program going. And then, of course, please utilize us as trainers. If you find things in these resources that aren't what you're looking for, you have questions about what you're reading, please reach out to us. That's what we're here for, is to support you in ensuring you guys are successful in your programs. IPS Works, all things IPS. So Dawn and Darren have spoke about this a lot. This is a really cool website. It's got tons of information, tons of resources. Please check that one out. The Provider One access, that's the link to get Provider One access for folks. You guys may want to utilize this if you don't already, to ensure somebody's connected to Medicaid. And Provider One will give you some of that information as well as some additional information. There's a link there for the Washington COVID-19 response. There's resources there around COVID-19, so please access that. There's a lot of stuff going on, and we can use all the support we can get around working with our folks. And so utilize those resources that are available to you. Please let us know if there's anything here that we didn't provide. We have so many more resources than we can put on one slide. And we want to make sure that you guys get what you need. We are going to be doing additional training as we move forward in reaching the deliverables of this contract, but you guys can utilize us at any time to do any kind of one-on-one, question and answers that you need to make sure that we are helping you move forward and implementing these programs. We're really excited to be doing this work with you. Next slide. And this is just our contact information. So us 4 trainers that you spoke with today, we are your folks. We want to be utilized to help you do this work. Like I said before, Amanda Polley is the supportive housing program manager, your specialist program manager, and she's for Eastern Washington. So she would serve anyone on the east side of the mountains. And Dawn Miller is the supportive employment program manager for East Side. So those would be your go-tos if you are over in Eastern Washington. And then there's myself and Darren Paschke, who is doing supported employment. We would be your go-tos for housing and employment here in Western Washington. So please reach out. Please get these somewhere where you can access them and utilize us as much as possible. We are so excited, like I said, to be doing this with you guys. Let us know if you have any questions. And thank you for joining us today. It's been great, and we look forward to being able to support you. So please, this is your time to ask questions. We have about 15 minutes before we're done.
I would mention that I had Holly made a request about the pathways to employment, trying to find it kind of as we were talking. And if you need to do a Google search to find it, put in DSHS, Washington Pathways to Employment. We as a team belonged to DSHS once upon a time and moved over from there, and the Pathways to Employment website still exists within kind of the DSHS realm. Incredibly helpful to job seekers with disabilities in general. So I did also put the link in the chat box. When I pull up the chat, I don't know if it went out to everybody. I seem to be having some technical difficulties. What a big surprise, since it's been going on kind of throughout the day, and for some, some of the attendees as well. But check the chat box for the link for the Pathways to Employment. Allison, I see you said thank you so much for the information, and you'll be reaching out, that it's been very helpful. Bless you for sharing that. I think as a presenter, one of my fears is that I'm wasting people's time, and so it's always nice to hear when something's been helpful. Even more so now with virtual, because we can't see people's faces to see if if things are resonating with them. And so thank you for the feedback. That does help a great deal to know that it's been helpful. So other questions? I know within the team we haven't discussed who's going to send out the slides, so we'll need to make that determination. But whichever one of us does, I think there's a couple of things that I would like to include, including the fidelity scale, so that folks have got that too. Just so y'all know. Sometimes we don't have time to communicate with each other either. I see Hallie says, thank you, I'll really appreciate. We've been doing FCS in a light way and are excited to create a strong program. Good to hear. And that's, I think the beauty of, one of the things that's really a beauty of fidelity is that it is never a gotcha. It's never a you're doing it wrong. It's always about, here are the things you're doing well, because there always will be, just like individuals we serve, there's always strengths of programs and areas where people can improve. So it is a continuous quality improvement kind of a thing. And from that standpoint, perhaps not as perhaps, certainly not as threatening as an audit. Those are scary. Been through lots of those. But I appreciate the fact that the evidence-based practices are about continuous quality improvement and about taking a program that's been working in a light way and helping to create a strong program. And really, truly, in the case of both of the evidence-based practice, it's about the bottom line. IPS is successful. If you use it to fidelity, IPS is successful in helping people get jobs. Permanent supportive housing, if you use it to fidelity, is successful in getting people successfully housed and maintained in that. That's another part of the beauty of the evidence-based practice and why we're so passionate about it, as obviously we are. So I don't see other questions. Team, are we ready to end the webinar and give folks back 10 minutes of their life?
I suppose so, Dawn.
Okay.
Sounds good. Thank you, everyone.
Thank you, everybody.
Thank you. Bye.
Bye-bye all.